Well, good morning everybody and welcome to this meeting of the Children, Adults, Health and Wellbeing Policy Development and Scrutiny Panel. So I'd like to welcome you all to this meeting, especially members of the public, and I would like now to swiftly introduce the members of the panel to you, and then when you speak, if you could introduce yourselves to us, I think that would be very helpful. And just one more thing about speaking. If you can make sure when you finish speaking, you turn your microphone off. That way, the camera will then follow the next person who's speaking, because the cameras are programmed to follow the microphones. Okay, my name's Dina Romero, and I'm a councillor in Southdown, and I chair this panel. And then to my left.
Good morning, everybody. I'm Liz Hardman. I'm Ward Councillor for Porton and I'm Vice Chair of this committee.
Good morning. David Harding, Councillor for the Chew Valley Ward.
Michael Alton, I'm the Ward Councillor for Midsummer Alton and I'm subbing for one of the other members today.
I'm Councillor Joanna Wright, Lambridge Ward.
Paul Crossley, Councillor for Southdown.
Sorry. Morning everyone, Kevin Burnett, Professional Association Rep for the NEHT and a non-voting member of the panel.
Good morning, Christopher Batten, National Education Union, non-voting member.
Good morning, I'm Ruth Malloy, I'm one of the Western Ward Councillors and I'm a voting member of this panel.
Good morning, my name is Leslie Mansell. I'm the Ward Councillor for Radstock.
Good morning everyone, my name is Mark Downford. I'm the Democratic Services Officer for the panel. Thank you.
Morning, I'm Kerry Williams and I provide the Scrutiny Officer support for the panel.
Well, thank you very much everybody. I'd now like to move to Mark to tell us about the emergency evacuation procedure.
Great, thank you, Chair. So yes, if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, you follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area, just outside Brown's Restaurant. And there's an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated as safe refuge where persons needing assistance should assemble. Thank you.
Thank you very much, Mark. And do we have any apologies for absence and substitution?
Just the one that I'm aware of, Chair, as Councillor Orton said, he is here as a substitute for Councillor Pancania.
Thank you. Now we move on to item 4, which is the declarations of interest. Does any have any interest to declare? Thank you. And urgent business agreed by the Chair. The only thing I would like to announce is that the task group that is looking at the work of early help and prevention, we have now had our inaugural meeting. And obviously we will be reporting back to this panel in due course as our work progresses. So thank you to everybody that has agreed to be on that panel. As I see around the room, there's quite a few members of this panel that are on it. And I'd particularly like to thank our co-opted members for taking part as well. So we now are on item 6, and this is the public or councillors' statements and questions. And I'd like to invite Naomi Trentham to speak to us. Thank you.
Thank you for inviting me today. My name is Naomi Trentham. I am co-director of Mitos Global Limited, an organisation that provides training, coaching and intervention for all ages and stages through BAMES, though at the moment our provision is mainly given to children between years 5 to 11. Our offering includes emotion coaching, speech and language therapy, sensory assessments and profiling, vocational support and currently 12 hours a week of alternative provision for 3 vulnerable students. We operate privately to families, as a service through schools and as a direct provider to the local authority. We serve over 60 children and young people every week, from group work in schools to therapeutic coaching for children with complex needs. We have a number on our current caseload who are either adopted or in foster care. Where possible, we work with the whole family. Why does this matter? There's a lot of data out there around children, attendance, school refusal and more, and there's also a lot of talk about parents being the problem. But what are we seeing on the ground? We're seeing a disparity in provision and support for parents and carers, with funding made available for children with a view to keeping them safe or getting them engaging in full-time school. But there is a lack of joined-up approach across the services due to time and financial limitations. Some examples. Single mum of 4, where the first child has ADHD, social, emotional, mental health, PTSD due to a knife attack. We are checking in, we're very concerned. Second child was groomed online, has ADHD, ASD, was permanently excluded from school, was in foster care, is now stable. We've been with her for 2 years. Third child is ADHD and school refusing. Fourth child, school refusing, though now stable after 7 months of working with us. There's been no direct help provided to mum, who has PTSD due to domestic violence. So our question is, how is she expected to do better? We have become her reference point. This is not funded. One family we know have one child with serious medical disabilities is under the care of the disabled children's team, one attending hers due to emotional mental health, and one with ADHD who's struggling to attend school is under the SEND team. 3 different teams, 3 different case officers, one single mother who has no direct services. There's no one practitioner overseeing the family, and the mother is terrified her children will be taken. Emotional validation and care that's been offered has been met with walls coming up and a combative response, because if she acknowledges her need and the help isn't there, she feels like she will fall apart. Imagine if all the professionals involved could work together and look at the whole family instead of each child. If funding was pooled and provision was broadened, what might change? Yet we know of a family where hospice care was provided due to a 4-year-old child with a terminal illness, who saw specific intervention for siblings, parents, wider support for the whole family, grandparents in the short, medium and long term. We recognise there are many excellent providers in Baines and incredible staff on the ground. But how are we different? We work collaboratively with families, schools and other agencies, taking a whole child, whole life approach, and then we stay for as long as we can or for as long as we are needed. We don't stop when a goal has been reached. We stop when we're no longer needed. We seek to build healthy relationships with our clients, fostering trust and connection, which we believe lies at the heart of any long-term success. Early intervention for children is better than intervention when in crisis, of course, but we believe that meaningful, sustainable impact needs to include a focus on the whole family. Thank you very much. Any questions?
Thank you, Naomi. Would you be okay if we asked some questions? Okay. So are there any questions? Liz.
Thank you very much for explaining what the work is that you do and how valuable it is. So I have 2 questions. Firstly, how are you funded?
We are funded through different means. We have various funding models. So for families, we keep costs as low as possible. With schools, we try and price point to enable more working around the family. And then with the local authority provision packages, spot funding, primarily.
Okay, thank you very much. Obviously, you need more funding, and obviously that's something, that needs to be explored. You said there's a lack of joined-up services, and I think you gave an example. So what would really help to have services which are working together? Would it be through you, or what should happen?
We don't mind who it's through. What we see is that, particularly when parents are in crisis, they are so desperate for the children to be okay that and of course, the focus from what's required from from central government is that children are in school. So that tends to be the focus. But we know that children who are dysregulated cannot learn. And if parents don't feel tooled up, then they can't provide that safe space. So what we really pride ourselves on is building that relationship with the family. So we believe that even if there was a single practitioner that was responsible for joining up the dots, and we know this is something that we've had lots of conversations with social workers and other professionals in Baines, and this is something they long to be able to do, but the pressure's really high. Because we're a private company, we have that autonomy to flex and work differently. I hope that answers the question.
Thank you, Naomi. A very full response. Any other questions from the panel? Leslie.
Yes, thank you for the information. Do you know what the long-term impact is on families? You talked in particular about a single mother trying to cope. Do you have any figures on what the survival rates are of that? Thank you.
We don't have figures at the moment. We're hoping to partner with the university to begin to build a more solid database. sort of base of data. We've got a lot of anecdotal information. So one young person, she was actually the mother with 4 children, the one that was groomed online with ADHD, ASD, who was permanently excluded from school. We've been working with her for 2 years. And when we started, if she couldn't get her eyelashes on, she would fall apart, and that's a week where she couldn't attend anything. She's actually at our provision at the moment, taking her exams. She is going to be attending college in September. She has succeeded in achieving her functional skills, maths and English. But more than that, she is able to self-regulate really quickly. And that's had an impact on the family. It's brought cues of safety to her younger sister, who trusts us because she trusts us. So, you know, that's 2 years of work. If we'd been able to get in there 5, 6 years ago when the issues really began to emerge, it would have been even better outcomes, I believe, for everybody.
Thank you. Any more questions, Kevin?
Thank you, Chair. How do you actually get involved? Who asks you to get involved, or how do you get involved, please?
We have built really good relationships with schools. I've been in Baines for 27 years, working in lots of different sectors, so a lot of it's personal connections. But due to before we formed MITOS, I was doing quite a lot of just one-to-one intervention in schools, so we've got good relationships with the Senkos, so we get referrals that way. We came into becoming a direct provider for the LA through a student who was at Bath Rugby Foundation and managed to get herself excluded from there, which is quite an achievement. And John O'Wood, the head there, knows me personally and felt that I'd be a good fit. And again, she sat her exams and managed to get through Year 11. So that began to build it. It's through reputation that we've built our client base.
Thank you. I'm not seeing any more hands going up, Naomi, but what I would like to ask is whether or not you would be happy to come and maybe speak to our early help task group. So I think that your insights might be really helpful for us.
Yeah, it would absolutely be a privilege. Anything that we can do. We want to be upskilling, not upskilling, but supporting the services that are already there. We're not looking to replace, so anything that we can do to help. Absolutely. Thank you.
Thank you very much. Okay, and thank you for coming to this panel this morning and speaking to us. You're more than welcome to stay for the rest of the meeting if you wish to, but you're also free to leave if you wish to too.
Thank you. I think I'll leave you guys to it. Thank you.
Thank you. Right, now I have changed the order of the meeting around fractionally, as I know Laura needs to go, so I'm going to ask Laura Ambler to speak to us now. This is item 10, and this is the Baines, Swindon and Wiltshire ICB update.
Thank you, Chair, and thank you for accommodating me on the agenda. I do appreciate that. Yeah, and just for clarity, Laura Ambler, Director of Place for Baines for the BSW Integrated Care Board. You have in your packs an update report. There are just 3 short updates today, 2 of which I think you asked for previously. So one was around the spring booster vaccinations. I think you wanted the breakdown of what was the percentage uptake in Baines, and we can confirm that that currently stands around 46%, so that's in line with BSW, which is around 45%, but it is certainly above national average, which is approximately 36%. The other update that was requested was an early sight on the ICB Accident and Emergency Survey. So to date, it's been completed by 822 people, and early data, some interesting stats that we've just pulled out there for you in the report. So I think notably 81% agreed that they didn't have any other choice of where to seek treatment. 65% said they felt their condition was serious or life-threatening, and 79% did not think that they should have attended anywhere else. We can tell from the data that's been collected that most people travelled within a 5-mile radius, and the highest number of respondents, 24%, was in the 50 to 69 age group. And obviously we'll come back with a more thorough update when we have that. And then finally, just a bit of good news around progress on the Trowbridge Integrated Care Centre. So we had just set out there opportunities to find out more about that provision. There are some drop-in sessions that are taking place. They're all listed in the report, and clearly we can provide further information as well if that would be helpful. So I'll pause there, Chair, in case there are any questions.
Thank you, Laura. I'm pretty certain there will be some questions. David and then Liz.
Thank you, Chair. Thank you, Laura. Regarding the Integrated Care Centre, who's staffing it in terms of doctors, nurses, physios, whatever?
Yeah, so the Integrated Care Centre is a new modern facility and it's transferring existing health and social care services from the Trowbridge Hospital. So the workforce model is around that. So that will be developed in due course, but it will be from partly existing workforce provision. And I think the other thing to say is that clearly it will be multidisciplinary teams, so it will be the opportunity for services to come together in one centralised hub. So that's the benefit, obviously, with it being an ultra-modern facility as well. So the opportunity of a brand new facility.
Thank you. Regarding the A&E survey, most people are travelling to A&E live within 5-mile radius. Kind of not surprising given the bulk of the population live within a 5-mile radius, I would guess. You know, you're in an urban centre. So is that proportionate to the distance people have to travel? So are rural people not accessing it because you've got further to come and therefore their health needs are not being met as so often, and they're being left out of the loop, if you like? And has the RUH done similar surveys in the past? And if so, can they, when the final results from the survey are known, can they be compared so that we can see if there's been any improvement or deterioration or things have changed? Thank you.
Yeah, I can feed both of those points back to colleagues to see if it is possible to do that data comparison. Just to be clear, the 5-mile radius was just the 822 people that responded to this particular survey, but you're right, of course, it's got a certain catchment, hasn't it? So I think they're two really well-made points, and I'll see with our BI team if it's possible to do that comparison.
Thank you, Laura. Liz.
Thank you, Chair. I'm just going to do 2 follow-up questions, basically, to what Councillor Harding has just asked. Firstly, the Trowbridge Integrated Care Centre. Now, I see it's an exciting new innovation, but can I ask, what is it replacing? And then secondly, can we have one of those in Baines, you know, particularly in our main centre of population, Bath? So that's my first question. Thanks.
So Trowbridge Integrated Care Centre was developed through a business case and secured funding through NHSE capital funding. So that's how it's being developed. In terms of what it's replacing, it's about relocating services to be in that ultra-modern facility, as I said, and the benefit of co-location of services. So currently, some of the provision which is at Trowbridge Hospital is obviously difficult in terms of the nature of the building construct, etc. And so this is a real exciting opportunity for that new provision to relocate there. So not necessarily a replacement as such, but a relocation and the opportunity for co-locating and thinking about multidisciplinary teams as we move forward with things like integrated neighbourhood approaches.
Thank you. But is anything like this planned for Baines?
So I think across all of BSW, including Baines, we are obviously looking at a state and we are thinking about what's the best way forward in terms of how we co-locate services. So you'll remember that we were looking at the integrated community-based care programme. We're clearly going to be, as part of that, thinking around where family health hubs are. We spoke a little bit about that last time, didn't we? Etc. So we will be looking at that. What I can't promise is that there's going to be the capital funding available for new facilities everywhere. Clearly, it's going to be about making sure that we've got the right provision in the right place to service community needs. But the principle of how we might co-locate multidisciplinary teams is the ethos of integrated neighbourhood working, and of course that's the policy direction we're being asked to take through NHSE, and indeed Children's Services in the Families First policy are being asked to do the same with multidisciplinary team working.
Thank you. And the final question is about the survey, and it's really good to see a survey about people who are using accident and emergency. And I probably would have said, well, it's going to show that it's people who can't get to GPs, you know, and have no other recourse. But the data's showing something different. But would it be possible, because the survey hasn't quite finished yet, it'd be really good to know the location. Where are these people coming from? Now, you said 5 miles. I live in Porton, and we've got Midsummer Norton, Radstock, all these areas outside of Bath, and I know an awful lot of people do use A&E. And secondly, could we have some more socio-economic background? I think if we know the types of people who need to use A&E, that maybe we can then plan for improving access to A&E. As we know, it's a very long waiting list for anyone who has to go and visit. Thank you.
Yeah, they're really helpful points, and I think you're right. Some of that data did, on the face of it, look slightly surprising, didn't it, and felt counterintuitive to what we might have thought. But I think possibly there is some masking there, isn't there, unless we get a little bit more granular and understand some of the drivers. So thank you. I'll take those helpful points back to you.
It may even provide an argument for the centre that Mrs. Was inquiring about. Kevin.
Thank you, Chair. A couple of things, Laura. Anecdotally, and it's a dangerous place to go anecdotally, but the sort of people that have had COVID boosters have seemingly, for the last round, been adversely affected. I just wondered what sort of factors, whether that was one of them, or other factors that are affecting what seems a low turnout, and is there a herd immunity figure you're trying to reach? And secondly, is there anything, I mean, just like the Peasdown facility where other areas were allowed to use it or use the benefit of their services, is there anything in the new Trowbridge Integration Centre that Baines residents and people are going to benefit from?
So, yeah, I'll take those in turn, if I may. So in terms of the anecdotal adverse effect, is that impacting on take-up? As you say, anecdotally, we've heard that, but I don't have any evidence to back that up or quantify that either way. So I will follow that up with our vaccinations team to see about that. In terms of the herd immunity figure, we don't have a target figure that I'm aware of that we're trying to reach as such, but we do have particular cohort groups that we are focused on. And I think that's the main area of focus. But again, I can take that back for a more comprehensive answer, and we can provide that by email in between meetings if helpful. In terms of the Trowbridge provision, clearly as we see, you know, Baines residents that are perhaps facing more towards Trowbridge are of course going to be able to look at utilising that facility as we have now. People use facilities cross-boundary, don't they? So I think, you know, that's the benefit of operating as a BSW system. So what I will do, there is a link to a website that does have a little bit more detail of the information of the Trowbridge Integrated Care Centre. So perhaps if I send that to Mark, it could go out with the minutes as well, and you'll be able to see that, so that you can see the nature of the services that are being discussed and the types of things there. But as I say, the drop-in sessions are planned, and we'll have more of that detail.
Thank you, Laura. Joanna.
Hi, thank you very much for your report. Would you be able to give us more information about the COVID numbers that we actually have at the moment, and also mumps, measles, rubella? Do we actually have any, what are the statistics of what's going on presently on those sort of numbers?
We do have a dashboard that will tell us the number of people that are currently in our acute hospitals with COVID. I don't have that number to hand at this moment. Are you asking for more broadly than that, though? Sorry. So the number of...
Well, I know quite a few people have COVID presently, and yet we're not discussing that amongst the community. So and also talking about herd immunity and how many people are having the vaccinations. I mean, do we need to be looking at those numbers, and what are those numbers presently?
Yeah, I need to take that one away. I don't think, given that we don't have that routine reporting requirement anymore, I'm not sure if we would have a robust number to know how much COVID is currently within the population other than those that have been tested or those that are an inpatient and an acute. So let me take that one away. Same for MMR. I'm sure that we have got information because obviously they will be reported through. So I can take that one away and come back. Clearly that will fluctuate, but perhaps if I have a look at what we've got and feed that back to you, Councillor Wright.
Okay, thank you. So, whilst I wait to see if anyone else has any more questions, I wanted to pick up... I'm sorry, Leslie, I did write you down. So, Leslie can go first.
Thank you, and thank you for the report, Laura. One or two things I'd like to pick up on this. I think the survey looks really interesting, and I know we've only got some main points, but are the equality, is the equality data being picked up in that survey? And it'd be interesting to see, you know, what sort of treatments people are turning up for. Is it more because people have had an accident, or more because they feel they're having a heart attack, or is it because they just can't get to see a GP? So it'd be interesting to see those coming out. On the collaborative provider, which I asked about last time, can you elaborate a little bit more about the changes that are going to be made regarding that? We know that some of the services are going to be transferred under HCRG, but it is a concern about how these collaborative providers are going to work when there's a move to cut 50% off the budget for the ICB in the first place. And just going back to HCRG, are you aware that the services are transferred, staff are being told that the trade unions are not going to be recognised? I'm not sure, perhaps you can elaborate on how this was negotiated in the contract. Thank you.
Thank you. Sorry, just jotting down notes. There's a lot in there. I'll take them in turn. So firstly, the equality data on the A&E survey. Yes, it is taken for those that complete it, if that makes sense. So people are not obliged to have to impart that information. So I think we just have to acknowledge that it's as complete as people are willing to do so. So we'll take a look at that and have a look at what that is telling us. In terms of the lead community provider, HCRG, obviously working in partnership across the system, the intention, as I think we've said before, is that we would come back with an update in June, just to provide HOSC, as we promised, an update on services having landed, and also any plans for engagement, because if you remember, we sought your views and thought that you may want input to what that could look like. Clearly, there'll be a link there also with the Health and Wellbeing Board, because it may well be that we want to think about how we do regular updates to that board in terms of delivery of services and performance. So we will make sure that update comes here, and colleagues are happy to come alongside me for that. Understanding the concerns around the 50% cuts to ICB, just to clarify, that's a separate issue in that the 50% cuts relate to the running costs of ICBs, not to that particular community contract. So I hope that just provides a bit of a clarification. In terms of how Unison were engaged through the process, there were several meetings with union representatives, including Unison, throughout the process as we went through the contract award. They continue to have those meetings and to be represented. Clearly, I think what you may be referring to is that from our perspective, there isn't a single union organisation that is recognised as being the single representative for staff, and that's because our staff are a broad church and may be represented by a number of unions, and so that's how that currently works. Obviously, all staff throughout that process were able to have their representatives and access them, as you would expect, in the usual way. But we did have a lot of ongoing conversations and representation from union colleagues during the process. I hope that helps a bit.
If I could just come back on that, I mean, I work in a hospital and we have 13 unions and we work together and we discuss with management various issues. We are all recognised, and it may be that the unions have been involved with regard to the contract, but what's happened now is they're told that there won't be the recognition. Clearly they can't stop people being in a trade union, but there's not going to be that recognition agreement, and therefore they'll not be able to raise issues directly with management through that. Now, whether they join and have a joint union committee as we do, or do it as individual unions, that's for them to decide. But I'm a bit concerned if they're not going to have formal recognition by HCRG.
Okay. Yeah, I think we'd be interested in your answer to that, Laura, particularly.
I'm not sure if that is one for me. I can certainly take that to HCRG, but yeah, I'm sorry, I don't have a response on that. So, Leslie, I'm not sure. Did you have all your questions answered? Was there any that you wanted to draw, sort of re-put? No? Okay. So I know that we've got HCRG, I think, are coming in June, is that right? Yeah? Okay. So does that mean, well, so Val Gracie, for example, will she be part of that? She might be able to answer some of those questions. Yeah,
that
that's the intention, is that we would come along with HCRG colleagues, yeah.
Okay, thank you. Right, so I don't think my questions have been answered. So I'm just going to start sort of at the back, as it were, on the report. And so you had respondents, you had 822 respondents. Out of roughly how many who have attended A&E during that period of time?
That's a really good question, and I'm sorry I don't have the answer, but that would be very helpful to know. We can find that out. Thank you.
And then the next question, which I'm sure you won't be surprised to hear, is obviously anecdotally we are aware that a lot of students have to use the A&E because they are not allowed to be registered with two GP practices, and I wondered how many of those felt that they had no other choices might be from the student population. And then
we'll get an age breakdown on that. At the moment, as you'll see in the report, the highest number of respondents were at the 50 to 69 age group, but what I haven't got here is what were the breakdown of those that did respond, and that would help us indicate if any fall in the typical age for students.
Yeah, I don't know whether students are more or less likely to want to answer a survey. And then you also said about 50% cut to running costs. So in terms of the services, would service users see any difference? You know, would this be then something that would need to come to this panel for, you know, us to, you know, be given that oversight of how that cut is manifesting itself in, you know, in that day-to-day workings of health services?
Yeah, I think at this moment in time, it's difficult to know what the full implications will be. So to be clear, it's 50% running costs and programme costs on ICB, so not on the commissioned services, which obviously continue. Clearly, if you've got implications of that nature on an organisation, that will have some sort of impact that needs to be worked through, and not least with how we work in partnership with our external stakeholders and joint partners. So I think what I'd like to do, if I may, Chair, is consider that, and then we can think about the nature of any update that we need to bring forward in future. I'm sure there will be one, but at this moment in time I just can't tell you the nature of what that will be, or indeed what any implications could be on the organisation.
Thank you. And then my last question, which sort of refers to communications from the Secretary of State. Have you received anything in light of the call-in that was put forward prior to HCRG starting this work?
Chair, I can confirm we have not received any further communication at this time.
Thank you. Well, thank you, Laura, and hopefully we finish that item in good enough time for you to get on to your next meeting. Okay. Right. So, as I said, I've moved the agenda about a bit, and I have moved the minutes as well to the end of the meeting, just in order to ensure that our meeting can flow as beautifully as it currently is. And talking of beautiful things, now I'd like to invite the Cabinet Member to add whatever he wishes to his update.
Thank you, Chair. I don't think I've ever been called that before, so thank you very much. Can I just start off by throwing a compliment towards Councillor Wright, because we heard about the Tree of Hope, and that's now moving forward. We had a meeting, I think it was probably Thursday or Friday, where we were talking about the planting of the tree, where it's going to be planted, and what we're going to call it. Because as a council, we've been working very closely with Councillor Wright, and it is important, I think, that we actually ask the children what we're going to call the tree. So we've missed the deadline in terms of naming it, but we've agreed that we're going to actually seek the views of young people around a number of options. And I think it's important that we actually recognise, in terms of being corporate parents, that we actually are going to be planting this tree, and we're going to have a ceremony around it, and we're going to invite young people along to it. So I'm sorry if I've gone off my report a bit, but I think it is important that we actually do say this is an important initiative which has been supported from the office towards Councillor Wright and everything that she's doing.
Can I just update you that we have had an email back from the National Trust, who are delighted that our 160 children in care are going to help us name this tree.
Brilliant. Right, so, sorry, I've gone off piste a bit, but what I want to do is just to start off by recording thanks to Chris Wilford, who's stepped up to fill Mary's place until the new director is appointed. And under those circumstances, we've then obviously had to make a few other changes. And in addition to Mary retiring, Lee Zywek, who's the head of Children's Services, has also got a job, and she'd be leaving us in June. And under those circumstances, we've had to make temporary arrangements before the new director arrives to actually deal with that. And I've put in the report a lady called Phoebe Holland, who's very experienced, very, very sharp, and, well, I think do a really good job following on from Lee. But I think it is also important because at the last meeting we thanked Mary for what she did, and I think it would be nice this meeting if we could thank Lee, who many of us have seen, particularly at corporate parent meetings, for the work that she's done for Baines, and she's been incredibly loyal, hard-working and dedicated. There's also the other point is that we've also tried to build up a bit of capacity for the department in terms of reviews and moving forward. So we've also appointed a person for an interim period of time, Paula Sumner, who's going to be working with Chris to actually develop up the transformation of the service moving forward. So I think it's, I'm just starting off by talking really about a few things about people within the organisation. In addition, I want to introduce Carla, who's going to be dealing with the report in a minute, probably a bit more than a minute, about youth justice, and Philip Franklin, who's had a lot of dealings with regards to the early years contract, which as we heard at the last council meeting, where there was concern, and Phil is going to deal with any queries anybody wants to raise on that. And Olwen, you know, and Laura, I think you already know reasonably well. So otherwise, I'm more than happy taking any questions on my report, Chair. Thank you.
Thank you very much, Paul. Can you turn your microphone off?
Of course.
Thank you. So, any questions for our Cabinet Member? Leslie, and then Liz, and then Kevin.
I think Liz was first, actually.
Out again, though, Leslie. That's why I've promoted you to first.
I'm excited now. Yes, thank you for the report. I just wanted to pick up around the safety valve. Too many bits of paper here. So, so it says we are continuing to enhance services for children with special educational needs and disabilities. So in what way are we doing that? And I've looked at the equality impact assessment, and I have to say that 3.5 doesn't give any actions in relation to that. So has that just been missed out, or will something be added? Will we get a later update on that? Yeah, that's all I've got for the moment, thank you.
Thank you, Leslie. Paul.
Can I just ask Chris to answer the specific question there, please?
Hi, good morning, everybody. In relation to the safety valve and the services that we're looking to improve and deliver, we've got 3 strands of work which we do in the safety valve, which we have brought here previously. And the 3 services is more early help, so we've invested a significant amount of funding from the Dedicated Schools Grant in the SEND and AP Advice Service, and a lot of work has been completed by the Education Commissioner, Owen Donnelly, to recontract all of our SEND services so that they're all focused in the right way. The second part is making sure we've got the right capacity in Laura Donnell as part of the service, which is the statutory SEND service, which we are now going through a big recruitment campaign where we're going to bring our caseloads down to where we want them to be, which is 150, to make sure that service has got the right amount of staff to be able to respond in the way that we want to respond to schools, the way that we want to be able to talk to parents. So really pleased with that, and I'm sure Laura will pick this up later, but I think and truly believe that that service is absolutely going in the right direction. We've seen fewer complaints, we've seen improved timeliness, and we are getting some really positive feedback from our parent care forum about the work they're doing. So that part of the service is definitely being enhanced. And we're also working through a significant capital programme which involves the opening up of resource spaces and hopefully the building of new free schools when the DFE unfreezes the free schools which you have been successful in bidding for. That's 2 schools to be built on the Culver Hay. So there's lots of significant services that we're developing through SEND. And what we've committed in the report is that once we've heard back from the DFE, we'll bring back a full report on those work streams that we've got going through. I'll take a look at 3.5 in the Equality Impact Assessment and make sure that's updated. Thank you.
Thank you, Chris. Any idea about when the timescales around that conversation with the DFE?
Chair, can I come in on that, because that's more of a political issue. I think it is true to say, if you remember at the last meeting, the children's meeting, we had the DFE present, and we were getting some fairly positive messages there that we were thinking it was going to be approved in the spring statement, but in actual fact it wasn't. So we've contacted the DFE both at a regional level and at a national level, and we've got really just holding replies from them, not actually saying no, but not actually saying yes. So it is an issue still for us that we're worried about that, because the whole concept around safety valve was around the capital scheme being delivered at Culver Hay. And under those circumstances, if they're delaying that, that's in effect costing us something like £4 million extra a year as a result of delays. So it is really important, and we're keeping the pressure on the DFE, and we're working still with them really effectively in the region. But I think at the moment the politics are difficult around budgets for the government, and so we're going to just try and keep that in front of them moving forward. And the other thing is around safety valve. I hope we could do a full report today with the resubmission of safety valve, but at the moment, because of these delays taking place from the government, then it means it's really difficult for us to actually put in specific figures for the committee to see. But as soon as we hear something back on the resubmission, which was the 30th of April, we'll be bringing back a full report, because I think it is important. In terms of the way that the council operates, the money for safety valve, the deficit on the safety valve, which this year is something like £10 million, and it's growing, nationally it's a problem, and we reported in the past about a £4 billion deficit for government. The last count was 4.9 billion, and it's growing. So it is a national issue, and a really difficult one for the government. I'm not being party political in responding to this. It is a difficult situation, and there's lots and lots and lots of discussions taking place nationally. So it is an issue, and I think Councillor Mance was quite right in raising the issue, but at the moment we can't give specific issues in terms of reply around the timescales. I really do wish we could.
Thank you, Paul, for your candour. Paul. Yes, sorry, it's only because Paul had his hand up and I thought it was specifically about this item. Is it not? Okay, in that case then I will move back to my list and I will go to Liz and then Kevin and then Paul.
Well, I had no objection to Paul going first, but anyway, thank you. Firstly, congratulations really is due to our excellent Ofsted report, Children's Services. I'm delighted to see the free bus pass for our care experienced young people 18 to 21 has been extended for another year, and we're leading the way in fostering families in the project we're doing, and of course congratulations to Chris. Just a couple of questions. Firstly, families first. Now this is another government initiative, and we are getting £400,000 from the government, but everybody's saying it's not enough. So how much more would be needed? And obviously it's building on best practice with families. So my first question, how much more is needed, and where are we going to get that money from to enable us to put that in operation? And then linking it in with what Naomi Trentham has just said, wanting for some sort of overall arching responsibility for people, parents and young people experiencing need. So will that be fed in to coping, giving help and support to people like Naomi Trentham's firm Mitos is dealing with? So that's my first question. Two more.
So there's two more after that.
Thank you. Some really challenging questions, thank you. I'll just start off with the fostering families, because I think that's a different approach. Getting foster parents, foster families is a difficult process for all local authorities. The government set up a front door system last year with the aim of actually not taking the function away from local authorities, but signposting to local authorities anybody who was interested, and they did a lot of work within communities. I think from Bain's point of view, we haven't actually gained an awful lot from that, because it's probably a bit more focused around the urban centres. So from our point of view, what we're trying to do is we're trying to say, let's have a slightly different approach to fostering. So it's not such a big step into taking a child, but then supporting families and using, if you like, professionals who may not want to actually foster, but they can actually work with families to actually support families. So it's a different approach. At the moment, that's got to be proven to work financially for the government, which is why they came down to see us and actually then explored a little bit further around that. So from that point of view, I think it's something that may develop nationally, and there's a lot of interest nationally. We've done a paper out to professionals in the service. With the families first, not enough money, I think I'll probably refer that through to Chris to answer, because that's a bit beyond my capacity to put a figure on that. But the other thing around the support to families, parents, I'm also working very closely. If you remember at the last meeting, we had Rachel from the Parent Carer Forum, and we work really closely with the Parent Carer Forum, and they do provide real support to parents, whether they are within the SEND system, but also parents where if they have been through the SEND system and not been approved, they support parents that way. So it is a slightly different approach, but they are working at the moment on a memorandum of understanding with us because it's important for us moving forward that we actually do have a better coordinated approach to working with parents. Because I think from that point of view it's really important, and it was interesting hearing Naomi, and we will try and pick up those points as well, because I did listen to what she was saying, so I'm sure she does professionally deal with us. On the finance issue, Chris, can you help me out on that?
Yeah, thanks for that. We don't have an exact figure of what that looks like at the moment. We're in the process of going through a business change programme where we're detailing what we want to our services to look like through the reforms, and trying to put together what we think would be the best example of the teams we think would have the most impact in Bain. So that will all need to be costed up. However, if you think about what the reforms are ambitious for, so having multidisciplinary teams, additional police officers, mental health workers, domestic violence workers, you then start to cost each one of those up, then it starts to look like that 400,000 would be way short of what we want to deliver. So there's a couple of things in that. We are petitioning the Department for Education regionally through the ADCS, the Association of Directors of Children's Services, to say we absolutely want to deliver the reforms. We think these are the right things to do, but the financial package at the moment doesn't seem to match the ambition for it. So we have to go through a process where we want to know what that looks like in terms of exactly who's going to be in the teams. There's a bit of work for us that we need to do with our partners as well. So we need to work with the ICB colleagues and with the police to understand what their offer would be there. But I think they'd all would be saying that they additionally would also need additional funding to be able to find the staff to put in there. So if you look at it funding all those new posts, it does at this moment in time look short, but I couldn't put an exact figure on it at this stage. But hoping in the next 3 to 6 months, as we go through the design phase and we look at the structures we have in, we should have more of an idea of what our ambition should be.
Can I just, before you come back in this, can I just also, they've done 2 pathfinders, the government did 2 pathfinders, and the pathfinder that was approved in the southwest was Dorset, and they put in several £million into Dorset for the work that they were doing. And it changes the nature of the work with social workers. It doesn't mean to say that all contacts have to be with children via social workers, but you develop the social workers actually managing other professionals so that they can work effectively with children. So it's a different model, but it's still very, very new, and I think at the moment we're just finding our way through it a little bit better. But it's a good idea.
Many thanks for that, and hopefully you will feed us information to this committee in the future as to how it's progressing. So thank you for that. Another question about early years entitlement and early years provider, and Charlotte Lucas spoke to us at Council about this, and again, I'm afraid it's from our government, but the idea now is that the government will pay for the provision for early years, but no extras. And I'm just wondering, 80%, I believe, of the funding for early years entitlement is coming from the government, and I assume then the remaining 20% will come from Baines. And is there any way around the fact that Baines can provide more help and care for particularly children with special needs? I think she mentioned that they wouldn't get this care. And also additional things like going on trips, which we know in the wider context of young people helps their attainment, and also with meals. So I'm just wondering, is there any way forward with this that we can look at this and provide some solutions?
Chair, anticipating this question, I remember Charlotte came along and spoke passionately at the full council, but I think the simple fact was that we were up against it in terms of the legislation and the requirements for the council to implement that. And I've asked Philip to come along, who's an expert on this, specifically to answer these questions. And in introducing him, I just want to make it very clear the pressure that's been on that team has been enormous. as a result of those decisions that were made. I think under the circumstances, it's been really positive in the way that we've tried to deal with so many of our providers. And I think, talking outside just before we came in, all but 2 have signed up. But at this point, I'll hand over to Philip if I can.
Thank you. I think the point about the 80-20 is the expectation that up to 80% of the income that providers will receive once the final expansion of the entitlement goes ahead this September will come from the funding that's passed via the council to our providers, and the 20% of income that they generate will still be through their own fees and charges that they make. But that, yes, that does represent quite a fundamental shift in how providers receive their income and the impact that it could have on their business. But of course, each different provider has a different set of running costs, depending on when they're operating from, depending on their business model, depending on whether they're in the private, voluntary, independent sector, or indeed a school with nursery provision. They all have different cost bases, and and they're all fairly unique. And there are, in fact, differences between how the costs are made up for each of them, particularly between schools, as in schools under academies or local authority maintained, and the rest of the sector. So there's a range of discrepancies in how they're funded, but it is about the fact that in providing a range of different services, how does one flat funding rate reflect what they're offering? And that's exceedingly difficult. On the one hand, we want to pass through as much funding as we possibly can to every single child, because every time you make an alteration, maybe to target something, that takes it away from another child. So you have to be very mindful with that. And we do have an early years reference group, which indeed Charlotte is a member of, who every time there is a funding change, we pull together and we inform them of what our proposals are as to how we're going to allocate the funding before we take it to Schools Forum, which is the decision-making body on each year's budget. And Kevin's a member of that and is well used to our debates, and indeed the fact that the Forum has been sending on an ongoing basis correspondence to the Department for Education explaining the funding difficulties that some providers have with the rates that we are currently able to offer, bearing in mind the cost of actually running provision. Now, with the update that the Department for that came from the Department for Education, that was based upon a local government ombudsman decision against another council, which has been highly publicised, and the DfE was seeking to reinforce the rules. Now, they're not saying that providers can't ask for payment for certain services. What they're saying is they cannot mandate it. And in fact, the Department for Education would like providers to be offering hot meals, activities, etc. But they want them to be mindful that obviously not everybody has the same amount of income in order to be able to afford them. And that's really where we've got to this point. But in fact, as was pointed out, we now have most of the agreements in and signed, although our next stage, the final stage, is actually happening this September, when the cohort from 9 months to 2-year-olds, and for 2-year-olds, both in working families, their entitlement will be extended from 15 to 30 hours. And obviously that's going to have an impact once again on providers' income. In terms of parents applying, actually, as of today, as of a briefing we've received from the Department for Education this morning, that phone line and website is now open for providers, for parents to increase their entitlement. So we'll have more of a clue as to how many are going to be doing that from September within a few weeks, because we will get some numbers as to how many have applied.
Thank you. So basically you're saying it's back to the providers to actually provide themselves or get it from their parents, charge their parents and carers the actual extras.
Yeah, the early years entitlement is a basic package of funding, and it doesn't include certain things.
Thank you. And I have just one other question, but I think it can go on to the our Youth Justice report, which is looking at the recommendations for knife crime. So we'll use until that. So thank you.
Thank you, Liz. So on my list, I've got Kevin, Paul, Joanna and Michael. Okay, so Kevin first.
Thank you. Just a quick comeback, please, if I may, Phil, on the last bit about the early years entitlement. Is the money coming from the government to the providers? Does that come with conditions in terms of how many children they must take? Or will it mean that providers who are looking to raise money will say, I'm going to take only those families who can afford to pay for the meals and things, and neglect, if you like, what the government may be aiming for, families who may desperately looking for a place that is funded?
There can be no conditionality on accepting the early years entitlement, and that's in the provider agreement. So the providers may set out what their particular offer is, but if there's places available, then there'd be an expectation that any family could use those places.
Okay, thank you. Sorry, back to your report, Paul, and endorse the congratulations that have gone for the various people, including the fostering families, and the report, the Ofsted inspection. Can I just pick up on some points that maybe have been mentioned by you at the last meeting, and just to see where things are at. There was something around, one thing before that, free school meals, which was on your current report today. You say that letters sent to families that they only consider that they're likely to qualify, and then what happens should a mistake be made, or if families are enrolled and they don't qualify? Is there anything around that, they're committing, or somebody's committing to paying money back or not paying money back, or does that fall on the council if a mistake is made? Just a question that was raised. And is the process entirely sorted by the local authority, and that it doesn't, if you like, mean that the schools have to do anything else but just say, oh right, we've now got 15 children on roll that have free school meals, or do they have to do some sort of return as well? That's the free school meal bit. And the other couple of questions around points from previous ones. The Ofsted termly conversations with education. Can you just let us know when the last one was, when the next one is, and what actually happens, as a general summary of the conversation? You mentioned that Dr. Vicky Jarvis was researching issues in the southwest around policy from the government. I just wondered whether she's involved with the early years entitlement debacle at the moment, and what she's done and her impact. Virtual school funding was ending in March 25. Just wondered if it has, and if not, great. And where we are with savings on early help services, if everything is going, nothing's been cut, changed, or anything else, please.
So, a nice set of easy questions. Thank you.
Free school meals.
Thanks for that. I'm not going to pretend to be a technical expert in this area. It's the free school meal service is delivered by the Welfare and Benefits team, which sits in the resources part of the council, not with me. But I would like to think they've got very good methods for making sure they don't inadvertently identify someone who's not eligible for free school meals. But I will ask that specific questions about what the mitigations are and bring that back as an answer. I'm not aware, Kevin, that there are any additional burdens on schools around this. It will just be the same as it is, but we will just inform schools that there are more, hopefully more children who are eligible for free school meals in the roll. But I'm not expecting there to be additional burden on schools. The process, what's been changed is at our end, in terms of the identification.
Kevin, can we also just pick up the point that in terms of free school meals and schools, there's real advantages for them to identify children who are entitled, because then they get pupil premium funding. So it's not an issue where we're in competition with the schools, we're supporting the schools. Oh,
I think there was more questions in that
the
one.
Ofsted, yes, sorry, the Ofsted conversation. I don't go along to the Ofsted conversation, and Mary was preparing and is now almost ready for the next Ofsted's discussion, and I think that's planned for June, isn't it, Chris?
Yeah, we're waiting for 2 dates. There are 2 types of conversations with Ofsted. Can I just clarify? Did you say Ofsted on the DFE?
It said Ofsted conversations, termly conversations.
Yeah. So I have a termly meeting with my link advisor, who it could be wide ranging really. It could be about concerns about schools, any patterns or trends that we have, any recent inspections that we might want to discuss. We also would cover things like the SEND inspections that are happening around there. In the last one, we had a conversation about the new proposed schools inspection framework, which you'll be aware of, Kevin, and he wanted to support me in finding space for us to do some open conversations with schools. So we invited one of the Ofsted colleagues along to the head teachers briefing, and they came along to the presentation on that. It really is quite an open engendered conversation about work in the area. We would also cover things like complaints, LADO, anything like that that comes through the door specifically. There is another conversation which happens once a year, which is now more focused on social care, although it will cover, it does cover parts of SEND and bits of the virtual school. It used to be more broad, wide-ranging around education, the annual one, but it's more focused on social care. And as Councillor May said, that one is due to be fixed in June, although we have yet to be given a date.
We do a self-assessment for that process, so we actually do lay out what we think our situation is. And I think just the other thing is to pick up the fact that with Mary leaving, Lee leaving, the temporary arrangements, we're going to be almost certainly under scrutiny by Ofsted moving forward. And I know Chris has been talking to Ofsted about the situation, the continuation of the services that we provide. But I do think we're several years now since our last Ofsted inspection as a local authority. So I think we can probably expect within the next few months, if not sooner, an Ofsted inspection of the local authority in terms of children's services. And you asked about Dr. Jarvis. I think she was quite specifically employed, and not by us, but down in Dorset again. But her role is quite clearly around SEND and safety valve, which doesn't apply to every local authority in the Southwest. So I've not heard anything implying that she's going to be involved with early years. Have I answered all your questions?
Virtual school funding due to end. I'm not aware of any funding streams that are going to end in the virtual school. However, they are always late to come in, so we're always waiting for funding. I think there are a couple at the moment which we are waiting for, which have now been confirmed, but we often get told you've got 1 year's funding, so we're always waiting year to year on that. But I don't know which particular funding stream was referenced, but there is no current funding streams for the virtual school which are due to end this financial year.
Great. And the early help services, the savings or not savings or any changes, that's not gone through yet at the moment?
I'm struggling. I'm not aware that there's any savings in the early years.
Okay, it may be me. I was under the impression, and I'm sure Liz or Dina may be able to know better than I, but that there was 400,000 from there was a large portion from adult social care and then from children's social care, and there were savings that had to be made.
Are you referring to, I think it's 300,000 that was in, was it in last year's budget? It was aligned to that, yeah. We had the 800,000 that was the adult social care, and then the 300. Is that what you're referring to?
It was, sorry, yeah.
Yes, I mean, those were in the medium-term financial plan, which was put out last year, not this year. And the implementation of that has included the review of the Youth Connect contract, which did contain savings, but that was a commitment that was made 2 years ago, but we've been implementing those savings, and that was a requirement for the budgets. Off from this meeting, I'm more than happy providing details to Kevin if that would help.
I think if you could circulate it via Mark, I think that would be really, really helpful. Thank you. Okay, I'm going to move on now from Kevin. I think you've had long enough in the limelight, and move to Paul and then Joanna.
Thank you very much, Chair. First of all, congratulations on a very good report. Just a general point, which I've asked for before, it would be helpful if we had more data to go along with these so we could see trends that were happening and see what it means. Specifically, I want to ask 3 questions on the fostering families point. So first of all, the first question is, how do you define the word family? Because certainly in Dina and my ward, family can be quite disjointed, it can be varied, it can be very different from a traditional family structure. So if you mean by traditional family structure, that's not going to work in some of the families that we work with. So for instance, several years ago, Dina and me had to work hard to convince the social services that an elder sibling could take over care of a younger child when her immediate family disintegrated, but she still had grandparent families around. So how do you define the word family when you're doing fostering families?
Can you turn your microphone off, Paul?
I mean, the nature of this is changing significantly in the fact that in the past it's been social workers intervene and children get taken into care. What we're talking here is that within families, we have family group conferences, which now much more about trying to support families, and it may not just be the direct parents, it may be the support families, kinship care, of providing support for young people when they come into care so they don't lose contact with their families. But the fostering families idea is very clearly around that you can actually get a different type of person involved in fostering, where it may not be a family, but you can actually support families within the context of them looking after their own children or relations of children in a way slightly different. What we haven't been able to do at the moment in terms of evidence is we haven't proven whether that's actually successful financially, but we have done a number of trials and it's working, and we're only talking about 6 families at the moment, but it's a way of actually supporting families rather than actually taking children into care. So it's an early intervention scheme, which we've got to prove whether it works or whether it doesn't. But it is a slightly different approach, because what you're trying to do is you're trying to work with professional people who may not be able to adopt a child, but can actually then work more effectively in supporting a family. So it's using the community in a slightly different way.
It does sound very similar to something we got happening in Southdown over a decade ago with the families. That's very, very good. So when you say you got this idea from other authorities, I mean, as I said, we did something like this over a decade ago with a family in Southdown. What other authorities did you copy, or was this something that came from within our own authority?
Very clearly, it's from within our own authority. The chief social worker came down to see us because we had received some publicity around the work that we'd been developing. And she came down to actually see whether this is a theme that the government could take up more generally. And as at the moment, we still haven't had feedback from her, but I think it's a lot of interest from other people around the trial that we've been doing in Baines. Because getting foster families has been really difficult for us. And in terms of dealing with the child in the most effective way, fostering is currently the best way of doing it. But what we're talking about is if you use foster people, fostering families in a slightly different way, you can hopefully stop a child coming into care. And that would be what we're trying to seek to do as much as possible. Because once you're in care, our responsibilities grow, but that's a whole legal process, and that's not necessarily the best for the child. And we've got to have a system that is best for the child. And we're trying new ways of doing that.
So thank you very much. I would just say when you do the report for government, it's not only value for money, it's value for children and value for families, as well as value for money. And my final question then is, I'm very happy that if this scheme is gathering attention and we're supporting others, when we support others, what impact does that have on our own services, or do you need extra budget provision in there to be able to support others, or do you get that as a grant from government to lead the way in supporting others?
Early days, Chair. At the moment, what we've done is a few technical papers which have received really good comment from other people. And as always, we will try and help other colleagues within our capacity that we've got within the organisation.
Thank you, Paul, and thank you, Paul. Can I ask Joanna to ask some questions?
Thank you very much for your report. I will actually, can I pick up with Philip Franklin on the early years funding agreement, please? So I have been contacted by a local nursery, and they feel that they had to sign the agreement under duress. They say in a letter that I know was sent to you, we have been pressured to agree to terms that could jeopardise our financial stability and alter the successful business model we have developed over nearly 2 decades. The changes being mandated could lead to detrimental outcomes for children, which is our primary concern. And I guess the wider issue is, one, some other councils have waited for greater guidance from the DFE, from what I can gather, and that they have not forced local nurseries to sign the agreement, whereas we have, and people have basically been threatened that if you don't sign this, you won't get the money, and therefore your whole business world collapse. And I think a lot of nursery providers out there feel that they had no other option. So I wondered just how many sort of letters you had like this. And then following that, one of the things that they're also concerned about with the new change is safeguarding. And one of the things that they are now being forced to do is change cooking and abilities for feeding children. Presently, they have a system in place where only children, they give children out food, whereas now parents are allowed to bring food in. And there are quite clearly issues with people having peanut allergies, etc., etc. And therefore, because children are so young, it's very hard to control this. So I guess my wider issue is why have we not waited for greater guidance and we forced nurseries to sign this when other local authorities have not done that? How many have sent you letters like this? And what are the safeguarding risks? Thank you.
Well, firstly, with regards to the agreement, obviously that was provided in template format for us to add our own things on from the Department for Education. And clearly, with their update, that was effective from the 1st of April. So there wasn't going to be any further changes. So therefore, if anyone had, from a parent or carer point of view, raised a complaint with us, we would have had to apply those instructions from the 1st of April. So it doesn't matter when an agreement was signed as such, other than it's an acknowledgement that you will adhere to the terms and conditions. But from our point of view, if we had had to do anything, and thankfully we haven't with any providers, we have already got the assurance that the agreement is signed. So that's why we went with it. There are very few, having talked across colleagues in the South West, this notion that lots of councils haven't implemented isn't standing up to the scrutiny that we've put it under. One or two have said, well, we will be, because we want to put in one or two other things, we've just basically said it's applicable, but you've already, technically you're already covered under our current agreement anyway. So the rules weren't exactly changed, but they were reinforced from that date, and we felt it was applicable that we should have the forms in. With regards to correspondence, we had lots of correspondence. All of the correspondence we have shared, like all of our colleagues up and down the country, with the Department for Education, so they have a full understanding. And in fact, based on our reference group, we invited the director from the Department for Education to come down on a visit and to see that. Unfortunately, they have declined due to their diary pressures. However, our providers have an opportunity. The DFE are having an open meeting for providers in Bristol at the start of next month, and a number have signed up to go to that already. So there is that opportunity there. Yes, of course, it will have an impact on some people's business models, but not everybody. And some of our providers came back to us and said, great, that's fine, we'll carry on as we are. So it has an impact in different places at different times. But with regards to food, the Department for Education has already issued their updated guidance since that. That has been published. And yes, I understand providers' concerns with managing allergies, and particularly around very small children. But obviously, when it comes to, say, school age, when children arrive at school, they're entitled to have a meal or bring their own meal in accordingly. Clearly, at the moment, with the universal offer for infant school meals, that's having an impact on how many people do bring in a meal, but they have that choice then. And that's the sort of approach that the government has taken with regards to this. But it does, admittedly, have staffing implications, particularly around supervision, and that's what the Department for Education has addressed in their new guidance around meals and eating.
Thank you. Next on my list, I have Michael.
Yeah, my question was almost exactly what Councillor Wright has raised, really. So obviously, Charlotte is in my ward, and we've had a lot of chats about this whole issue, and she was very concerned about how the short time that has been given for nurseries to have to sign or to sign the agreement. Also, she was very, very concerned about the food issue. When she's got a forest school of 100 children, managing 100 children when they all want to share each other's food and have no concept of what's good or what's right or wrong in terms of what they're allowed to do. And so she felt actually the agreement was putting her own children at risk. And actually that's one of the reasons she didn't want to sign the agreement. As far as I understand, I think she has signed it, but under duress. It was definitely under duress. And when I spoke to her, there were at least 5 other providers within the room that had all just finished the meeting, all of them feeling exactly the same. And I think between them, they represented something in the region of about 3,000 children across Baines. So it's a very big issue. And the food issue was just one of our range, but that was one that had a very, very pressing. So even if the Department of Education have food guidance, it's the practicality of how you deliver that and how you make it possible and safe for children. It puts an awful lot of pressure on staff to have to kind of manage that as well, which is not fair on them. And so really for me, it's what is Baines doing to kind of help support providers if that is an issue that's coming up. And it's not just one voice, it's multiple voices across Baines. Yeah. Thank you.
Well, with regard to the regulatory side on food and things like that, that actually sits with the colleagues team, and they will be looking at what's come in and be giving advice and guidance out accordingly. But yeah, it is a challenge, and the Department of Education have said, where possible, they would like parents or carers on behalf of their families to take up the provider meal offering. But what they're saying is it cannot be compelled, and therefore an alternative must be available should a family not wish to take up that meal offer. And that would involve family bringing in their own lunch and the implications that has on the provider in supervising that arrangement. So it's not something we've set here as a council. It is a national requirement.
Chair, can I ask that we take this issue again further in another meeting, and that Councillor May looks into it and comes back to us, and maybe somebody can attend the Bristol session that's being suggested?
I'm sure Councillor May would report back as things progress, as I understand it. I think, and I'm just double checking, but I understood that government was also consulting on introducing a universal free school meal offer to through nurseries as well anyway. So maybe that also might help address some of those concerns. Anyway, so Michael, if you could turn your microphone off, because I think the camera's just probably been on you this whole time. And Philip.
So I was just going to add, we have got one representative going to that meeting. Councils are only allowed a single representative, so there will be somebody attending.
So I've got Paul and then Chris, or it might be the other way around.
When this came out, we were really sympathetic to the situation that the providers were in. So it's not just been dealt with in a hard way. We were given virtually no leeway in terms of implementation of that piece of instruction. We went out and checked with our legal service of whether we could defer, and we got a very firm message back: no, it's there, it's the rules, it's the regulations. And we also contacted the DFE before that deadline to actually seek whether we could defer, because we were hearing from others that other areas had deferred, and the message we got back was it's the regulations you've got to implement. So we understand the concern, but I think it's true to say that we've got to operate as a local authority correctly and properly, and the implementation of that those agreements is a requirement that have been set on us. So I don't want us to come over that we don't care about this. We do, but we've actually been required to do it by regulation.
Thank you, and I need to correct myself. I think actually the universal free school meal offer is actually something that is in Wales, but not currently being looked at for England. Unless Chris wants to correct me, having corrected myself.
No, I don't want to correct you on that. I just wanted to advocate a little bit for the early years team, really, who I don't think have coerced anybody into anything they didn't want to do around signing that form. It is, I think, the real issue is about the overall funding that early years settings receive, and we shouldn't be distracted from that fact that we don't think per child that our early years settings are given the money they need to deliver the service, which is why some services do operate a business model where there is charging. Now, we have to also remember that that charging is still can happen, it's voluntary. All it means is you can't coerce it, so we still will have lots of parents who are happy to pay those charges because it's more suitable for them to purchase a hot meal or do those activities. So we just have to remember it's not the council imposing those regulations. There have been many, many providers who have contacted Philip's team to thank them for the work that they do. On Schools Forum, the two early years providers who represent the sector were very positive about Paul and his team as well. So I just wanted to advocate that. It was a difficult time for everybody involved in that, but Paul's team worked diligently, Philip's team worked diligently and conscientiously through that period.
Okay, so a lot of this then has stemmed from government decree rather than changes that we might have instigated. Philip.
And I just wanted to say, obviously, we also have to think of the parents, the carers, families, and the children who are benefiting from this as well. And the demand is exceedingly strong, so it's obviously a popular scheme. It's just that popularity versus the funding challenge that we find. So, you know, we also have to think of who is benefiting from the scheme as well.
Thank you, Philip. And I think we all echo the comments that Chris has put on how great your team is. Okay. So where did I get to? Ruth.
Thank you. Yes, thank you for your report. Just a couple of small things, really. The West of England Music Alliance, I welcome the fact that we will be receiving the newsletters. I haven't had one yet, though. So is that being actioned? That'd be good. And on that topic, so sort of communications and being kept in the picture about things that are going on, were we not going to also be sent calendar reminders for the Health and Wellbeing Board meetings? Because I think that, you know, if we can sometimes come to those meetings or at least be reminded about them, I think that would be really helpful because they're very much interconnected with this one, aren't they? Together.
That last question might be a Democratic Services matter, Ruth, which I'm sure they'll take up. Sorry, Paul.
The Health and Wellbeing Board is a formal board of the Council with partners, so that information should be normally available anyway, but I'll follow that up with Mark to make sure that that is being done. We had a meeting just a week or so ago, but I'll check on that, Chair, because it's really important, I think, that if members can get along to it. The Labour Party are the official observers of that, so they sit at the table. So that party quite clearly is involved in it, but it would be really sensible for us to make sure for the whole committee that that information is going out. So I can only apologise if it hasn't. With regards to the newsletter, I'm hoping I've given Chris a couple of seconds to check up to give a proper answer.
The newsletter is produced by West of England Music Alliance. Yeah. And it's not out yet, which is why you haven't received the latest one, I believe. As soon as it said he produced the latest one, he'd send it on to me, and I'd take an action that I can share. He'd also he also reiterated his offer that he's happy to come here and talk to the committee as well. He'd been unwell and then had literally answered my email whilst he wasn't well, so I didn't want to push him to attend at this moment.
I think we'll pop it on our work agenda, our work plan, that when he is well enough that he can come to speak to us. Leslie.
Thank you. I just wanted to pick up on the free school meals, the auto-enrolment. So we are going to get a report on this. It's great to see that it will be happening as of September. But if people really don't want to have school meals, can we ask them why not? Because it seems to be a very clouded situation where the information is just not there. And it'd be interesting to find out why people don't want them. Is it because of allergies? Or is it because they'd rather send their children to school with a McDonald's that's going to sit in a classroom all day rather than the fridge? But it would be really useful. I mean, I've got my own ideas as to why that might be, but that's my ideas, not the actual fact. So it'd be helpful to have that information. Thank you.
Okay.
I can put that to the team, since we do collect information about why a parent who is eligible doesn't take up the offer. I can answer that question.
Thank you. So I've just got a few points that I wanted to raise. One is going back to the funding from the for the early years entitlement. Could you just clarify, because I think you've said slightly different things. This money comes in from government and then it's passported by the council to the providers. Is that correct?
Yes, it's part of the dedicated schools grant funding that comes in from the Department of Education. They assess how much budget we get in terms of actual money based upon the annual census that we send to them, data, but then they allocate the money like they do with the rest of the dedicated schools grant on a formula basis. So that formula has various different factors in it. So each council up and down the country gets a different hourly rate depending on where they are and what the DFE assess their value to be under the formula implications. So we won't get the same as any of our neighbours, but we are obviously expected to deliver through our providers exactly the same.
And is it like the DSG then, in that there's an element that might be top slice for example, SEND?
Our SEND funding actually comes out of a different bit of the dedicated schools grant for early years. There's an element that's top sliced obviously for the council's running costs of the services that it provides, but the rest of it is passported through. So at the moment, the Department for Education have actually decreased the top slice from 95 to 94%, and they're intended to decrease that to 93%. So more money should be going to providers in their view.
It's really, really helpful to get that clarification. And then sticking with early years entitlement, one assumes that this will encourage more families to want to take up a place. So are there enough places?
What we've seen so far with this change, which is actually lowering the age of funding availability, it was a legacy issue from the previous government, was because it's targeted at working families and because Bath and North East Somerset has a high percentage of working families anyway, what we've really seen is a shift from people who would have previously paid to now receiving the entitlement. And they will be getting, have obviously been getting 15 hours and having to pay for any additional hours that they take on top, and that will be increasing from September to 30 hours. So we've not really seen it drive the employment market rather than just be a switch over. So therefore, given that our market, we were meeting the spaces available within the market, we haven't really seen any further pressure on the place availability as a result of this change. Thank you,
Philip. Paul, did you want to come in on
yes,
this?
just very quickly. The funding arrangements every year are done through the Schools Forum, and the early years providers have 2 seats on the Schools Forum, so there's always discussion and consultation around that, but they are national formulas, and we don't have to have the national formula, but we've, as a principle for a number of years now, applied the national formula. So really just to say that there is proper consultation every year, and it's usually just before Christmas time.
Okay, sorry, that just reminded me of another question just on this bit, which is around SEND providers, and so I think BOP is one of the providers of pre-school placements. And would they be funded in a similar way? I'm aware of this question around SEND funding, which may or may not be different in terms of the EYE. Oh, it's complicated enough for Olwyn to come in.
So BOP are a commission service, so they are funded by block commissioning and annual commissioning, but they do draw down different entitlements and grants, such as disability, living allowance and things like that.
Yes, I just wanted Olwyn to confirm that part. So although they have that contract, the children who go for the hours that they go are still entitled to draw down early years entitlement on top of the funding that goes to BOP to provide that service.
Thank you. I think I'll be pleased. So I think I'm leaving that theme now, and I'm going to move on to unauthorised absences. So, and this is somewhat anecdotal, but I am being told that apparently this council has quite a high level of fines. That, and I wondered whether or not that was true. Really, that's my question on that subject.
We certainly have seen an increase in the use of fines for non-school attendance holidays, things like that, which is driven again by government policy. Whether we are higher or lower than other regions, I don't know the answer to that one, Councillor Mera. I would have to take that one back to my colleague who looks after the Attendance and Welfare Service and share it.
Perhaps in your next report you could have something about unauthorised absences, Paul. And my last question is just well, I think it's quite a nice request. And I've been asked whether or not, if those pupils that were at Culver Hay, if they could perhaps at some point visit Culver Hay before it's demolished. I think they would be very appreciative.
I've given that commitment to all local members about that, and I've spoken to the corporate property team, and we would be arranging that because although the funding has not come through from the DFE, and we haven't had negative response yet about the scheme, and under those circumstances we're carrying on with the demolition of the site. So I'll make sure again that is picked up, because that is a public commitment I've given to all local members in the area, and we'll make sure we follow that through, and I think it's a really good point, Chair. Thank you.
Thank you, because I think the place has a lot of special memories for residents locally. Okay, not seeing any more people who want to say anything more to you specifically, Paul.
Thank you.
So we're now going to move on to the next item, which is the Fossway House residential provision update.
Can I just start off once again in introducing Laura? I gave a commitment at the last meeting where this came up, I think, in the adults part of your committee, that I would do a full report. And under the circumstances, it's been a highly professional report that's been provided by Laura. And just before Phil goes, can we just thank him very much and make sure we do pass on to the team the support the committee's been giving them, because they've had a really difficult time. So thank you very much for that. So can I then at this stage then ask Laura to take over, because I think there was a lot of publicity around this, but once again the decisions that have been made with sensitivity to the situation for Fossway, the learning partnership. But the simple fact is there's been a lot of work carried out with them over a long period of time. And there is an issue around what's the definition of that provision and how that provision is provided in terms of equality across the whole of Bath and North East Somerset. So over to you, Laura.
Thank you, Paul. Thank you, colleagues. So this report is no different, really, in its contents to the one that I provided to you last time around the Fossway House closure. It's still the local authority's view that the needs and the plans of young people at Fossway School can be met during a day provision. And we're talking about their educational needs there. And for over 3 years now, we've worked with the Partnership Trust to see if we can expand the type and needs of young people who can attend the residential setting in order to continue to place young people there. As reported last time, we haven't been able to do that, and that's with the support of our social care colleagues, both children's and adult social care, working collectively on this. And so the decision has been made from the Partnership Trust to close that provision this year. Just a reminder to councillors that the provision itself is not run by the local authority, it is run by the Partnership Trust, so any decision to close is theirs and not ours. However, in true honesty with you, we don't have any young people to place there, and therefore that's the situation that we're in. We have offered places out to other local authorities, as all of our schools offer places to other local authorities, and no other local authorities step forward to say that they have young people whose needs should be met at Fossway House either. And so I'm here for questions, really, rather than a change to that report. We're still in that same situation where the young people are on one-year placements. They will complete that placement as planned at the end of this year, and then we do not have any other young people that will place at Fossway House from September.
Thank you, Laura. Do I have any questions or comments from the panel? Liz and then Kevin.
Many thanks for your report. It's difficult for us to understand why this residential provision is being closed, because it has been open for quite some time. We have young people still there. I assume there are young people who attend the Fossway School who would then attend at Fossway House in the coming years. But it looks like the criteria has changed. Now, I get what you're saying. You're saying that there has to be a residential requirement for educational needs and not for health needs. And therefore, if there has to be something for health needs, it would have to be recognised by the CQC, and social care commissioners would be involved. I've got a series of questions to ask, Chair, if that's okay, and if that's okay on them. Firstly, the youngsters who are there at the moment obviously have educational needs that need to be met with a residential accommodation. So I'm just wondering, are there children like these current children in the pipeline, at Fossway School, who would progress to a residential accommodation at Fossway House? Has the criteria changed that Baines is using? We've heard that there are educational needs include things like social skills and being able to operate in social settings, and to gain independence, which would be very difficult to actually provide during the day. So that is, I believe Fossway House would say, that is the main reason why they should be kept open. So I would like you to see if you could address that. And would there be youngsters who are already attending Fossway School who have the same needs that youngsters currently at Fossway House, the residential element? Are they there? And if so, what provision is there for these young people to gain these skills by staying in an educational setting if this residential setting is no longer going to be there? And I'm going to stop there because it's quite complicated and I have other questions, but perhaps if you could address that first, because I think the basic element of this is the education, residential accommodation is not needed.
Yeah, sure. So, without wanting to go into the technicalities of how an EHCP is written, there's a part in the EHCP called Section F, which says what the child needs to meet their needs, the provision in the plan. Those are written in a way that can be interpreted by the school or setting in order to ensure that they can be met in different ways for different children, so that we can meet them in a bespoke fashion. If we're really prescriptive in Section F of the plan, that becomes incredibly difficult for settings. And the type of provision that you're talking about, where it's for social skills, independence, etc., in all other special schools, so for example Knoll DGE, Soundwell, where we have large numbers of children, and our own special schools, Three Ways and North Star, that is delivered during the day curriculum and through extracurricular opportunities. Looking at the plans that we have for the children at Fossway, it is the multi-agency panel's decision that those needs can be met during a day provision. It's actually incredibly rare, not impossible as you're saying, but incredibly rare for them to have to be outside of the school day, because there's a difference between what the sort of gold standard platinum package, which might be a residential provision, and a good enough package that still meets those needs as laid out in the plan and still allows them to move forward and onto residential potentially in the future. We're talking about a really small number of children, so it's very hard for me to speak about, even to give general examples, because you could incidentally, or somebody watching this incidentally could assume it was about a specific child. But we have looked closely with our partners in social care and educational psychology, and we are confident that those plans, those needs can be met during the school day. And so for that reason, they should be met during the school day.
Thank you for that. But there are children who are there in the residential accommodation for whom Baines has obviously thought for this coming year and previously, I know you've been having discussions over the last 3 years, but this provision has been open for at least 10 years. So suddenly it looks like Baines is changing the criteria. I hear what you're saying. This provision can be accommodated within the school day, but we all know the national curriculum is very crowded. In the past, it has been accepted that this sort of residential accommodation is appropriate for these children. And to add to that, so what happens? So obviously, this is what Baines is saying, that no longer going to provide £30,000 a year to support one child in this educational residential accommodation. So have we got any other support in place? Because there's obviously a need for extra social skills, learning to be independent, which, you know, you've said there are other special needs schools, but Fossway School is saying that these sort of skills, that there are children who do need these sort of skills. So what other support will there be in place when Fossway House closes, if it closes?
So we'll expect Fossway School to provide that during the school day, as they do for their other children who have needs in the social skills areas, and our other special schools do. So Fossway School will continue to deliver what's in Section F, so the provision in the plan, as we would expect them to do for all of the young people on their role. I think you're right that through the safety valve process, we have reviewed all of our policies and our schemes of delegation, our panels, and how decision-making is made. And it is a lot more robust than it was before. I can't speak to decision-making 3 years ago, 2 years ago even, but I can speak to decision-making now and say that because of equity, it is important that decision-making is really clear and transparent, and that we follow that for every single case. And that's what we've done here, as we would do for any other children in our other special schools. And when there is a decision for residential, which is I have to be honest, very few and far between, unless there's a significant social care need for the young person, then that is discussed at a multi-agency panel and a decision is made there, which is the way that the Code of Practice expects for it to be done. So in June last year, we did write a new scheme of delegation, but there was no specific criteria in there around Fossway House, just that we always review the provision that's required to meet the needs and how to do that in the most cost-effective way for the local authority with our mind on the public purse.
One last question. Educational healthcare plans, and obviously sometimes part of the educational healthcare plan will be an educational side to it, which means that some sort of residential accommodation is needed. So in order to be placed at somewhere like, wow, that's a lot of buttons, at Fossway House, obviously it would have to be a high-level educational healthcare plan. And, you know, are you aware of any of these forthcoming in the near future? That's the last one. From Fossway School.
So most often, if there is a residential placement combined with education, it's because there are social care needs that need to be met in a residential placement. In fact, the only other options that I have that I can think of that come to the top of my mind is where the school is so far away that the distance they would travel makes it impossible for the young person to travel, and that's why they reside at the school. A provision of 24-hour curriculum is incredibly rare, and no, there's nobody else coming at Fossway House that I expect to have that kind of curriculum. If that kind of curriculum is required, the disabled children's team in social care more often than not are involved, and quite heavily involved with that family, because the needs are so significant. And so I really can't think of a situation where there wouldn't be social care involvement, where we would require such a large package of education, in which case we would work with our social care colleagues to make sure that we can provide that for the young people. And yes, because Fossway House is potentially closing, that would mean that it would be out of county for them.
But at the end of the day, it's the Partnership Trust's decision whether they close that facility or not. Okay. Kevin.
Thank you, Chair. I received this morning an email from the Partnership Trust about today's meeting with some points to raise, and I quite understand if these points cannot be fully answered at this moment in time, but I think it was important that, as I was asked to raise at the panel meeting, they're raised, and if it can't be answered at the moment because of lack of information, that maybe it can be circulated to the panel at a later stage. So the points are these, and I apologise because there's 7 points, but these are them. First point was in January this year, the Partnership Trust submitted 6 evidence-based proposals for Section F of the HCPs for students. And at the current moment in time, they're saying that Baines has not responded to that, despite being chased. The second point, parents and professionals working with students have all identified a need for the 24-hour education, but Baines have ignored this evidence that's been submitted. Third point, the nature of complex needs means teaching the skills required for independence means that children are unable to contextualise the learning in a classroom. A 24-hour provision allows for the teaching of these skills in real-life contexts. Next point, parents can't teach these skills at home. Next point, parents have not received amended EHCPs from Baines to be able to resolve disagreements. And the last 3 points is one parent did not agree with an amended EHCP, yet Baines published it anyway, and the parent is now seeking legal advice and advice from Sendias. Penultimate point, Bath-Ness sent an EHCP which had residential outcomes and then withdrew it, stating they sent the wrong copy. And finally, children accessing Fossway House currently don't access their full day of education due to the diagnosis. For example, a Down syndrome student who needs long rests, a student with a PDA profile who may spend a large part of the day not accessing the classroom, and for these and students like them, a 24-hour education is required for students with those profiles.
Thank you, Kevin. I think we're at risk of discussing individual cases, and I certainly wouldn't want to do that in this forum, so I think the last couple of questions will need to be disregarded, but I could come back with a more general response for you. So you're absolutely right that we received annual reviews, as we would for all EHCPs from the Partnership Trust. Those were processed in line with the dates that are given to us through the Code of Practice for phase transfer, and were sent out to parents within the phase transfer deadline. And my understanding from my team is that all of those were issued and received. I'd be interested to have a copy of names from the Partnership Trust if they believe that hasn't happened. It's my understanding that it has. And you're absolutely right that there was an error in one plan where they sent the old copy of the plan out again. Sometimes that happens, and I'm really sorry that that happened. The officer immediately rang the parent and apologised for that. Unfortunately, it's human to err, and that's what happened in that case. I'm disappointed that it did, but it did. And so another copy was sent out afterwards. I understand what the Partnership Trust are saying around the complexity of the children's needs and the need to contextualise outside of the classroom. There's lots of case law around this, and I sent a copy of the case law to you prior to this scrutiny today, so that you could, if you wanted to, have a look at when this has gone to tribunal and conversations have happened at both lower and upper tribunal with the judges there. And they have been clear that the local authority, that it's very unusual for this to be the case where you can't contextualise outside of the school day if the curriculum is flexible enough. So, for example, includes trips, it includes education off-site, it includes options for enrichment, and we would expect that from all of our special schools. And I know that the Partnership Trust do that for their children there. I think disagreements around what goes into plans, it's not uncommon for there to be disagreements, but we do make sure that all of our decisions are multi-agency, with professionals including education psychology and social care and health around the table when we make these decisions. But we're never going to completely agree all of the time about what goes into the plan, and that's why there are options for redress for parents, including informal mediation. So I'm not talking about necessarily going to tribunal. We'd want to avoid that at all costs, but mediation funded by the local authority, CNDS funded as well to support the parents, and Bain's Parent Carer Forums. So that there are those things set up around the parents and families to support and to resolve disagreements when they come up. Unfortunately, in this world of SEND at the moment, disagreements are common, but we do our best to resolve them as quickly as possible, and I would ask that the Partnership Trust continues to try and work with us for the provision for these young people and to come to a conclusion that supports all. The reality is, if there was just one child that was going to attend there next year, the provision still wouldn't be viable. And so it's a very difficult situation where if we sort of ask them just to take one young person, that isn't going to be a provision that will continue to run. And so I completely understand the difficulties with families and trying to communicate in the right order. We tried to communicate really early in October that we were looking at 0 or maybe 1, and that wouldn't be a viable provision for them to keep open. And so you do, there's 11 places with only 6 filled. You do reach a point where you have to be honest about how easy it is to keep that open for the Partnership Trust, with no other local authority placing children there, which you could argue, if that provision was desperately needed across all local authorities. I'm telling you now, Somerset, Wiltshire, they'd be biting their hands off for those places. So there is something about those places and the restrictions around it, around what type of children can attend, etc., that make those places very, very difficult to fill.
Thank you very much. Okay. Leslie.
Yes, thank you. I just feel we're in another Newton House situation where a decision has been made and we're putting at the facts afterwards. First of all, to say there's no data in this report that I can see. And it also talks about there's no climate change impact. Well, if these young people are then going to go out of county, surely they're travelling further, so surely that is going to be one impact on the climate. What does concern me is that the provision that's been made for these young people has made a fantastic difference to their lives in the long term. And that the long-term cost of that is going to be far more to this council than what we pay now. So at the moment, it costs around £30,000 for these children. And they don't go there every day. It's only 4 nights a week. So they're not there every day. But if they can't go out and function in society later on, they are probably going to go into residential care. So that's going to be long-term. We had this argument about respite and Newton House. So I'd like to see some facts and figures. I'd like to see a cost-benefit analysis on this. Because to me, much of this is just around, well, explanations to why we can't do it, rather than looking at a facility that's had 3 outstanding reports from Ofsted in a row. And I can read you some of the things that they've said. This is the Ofsted report. Now, bearing in mind, Ofsted are not the easiest people to get a good report out of. We know that. But it talks about the leaders are ambitious, innovative and drive research with the goal of improving the experiences of children who attend the residential provision. Consistent and persistent support from staff means children return home and do tasks they've never done before. The children have life-changing experiences and prepared for the future. Oh, what a fantastic thing they're able to do there. And I'd be really concerned if we throw this away. I'm also very concerned that, they were sort of warned last October that they weren't going to get any more referrals. But there's 6 people that had EHCPs to be reviewed. They're reviewed annually, and they've heard nothing. Now, how have these changed? If you've got a disability, the definition under the law is it doesn't change, and that it doesn't get better, but it may well get worse. So I can't understand why people that are getting an EHCP now are not going to get one as of January this year. There's also the issue of, it says at 3.5, no requests have been made for mediation to resolve disagreement or dispute or requests for tribunal resolution from families following this decision. What this organisation does, it works with families as well with children. They may not have the wherewithal to put an argument or go to court. And in fact, we had Gillian Taylor here at one of these meetings not that long ago, saying how she spent £2,000 of her own money going to court to get in the HCP. How much does it cost the council to go to court when these decisions are challenged? Because I'm sure it's more than £2,000. And if you heard Naomi right at the beginning of the meeting talking about the work that her organisation does with families, it's long term. You know, she was talking 2-4 years. It's not, you know, a 6 months effort or a year. It's much longer than that. And sometimes you've got to put the work in to get the change out of it. And I can circulate this Ofsted report. They're not secret. But there's lots of information on how marvellous this organisation has been. And as for the curriculum, can you please explain how you're going to put that additional effort, the additional things that this organisation does? For example, one of the things they do is encourage children to try different types of food, because quite often they're eating all the sorts of things that are really unhealthy. Of course, they're the nicest things to eat. And getting children to change from that kind of diet to a good diet is very hard. But they're succeeding in doing that through the painstaking work they're doing. And have you been to visit Fossway House? Good. I went. And I must admit, what impressed me was that it didn't feel a bit institutionalised, and that it was clean. It was so clean. it was quite remarkable. And just those little things can make such a difference to people. But I would like to see a cost-benefit analysis on this before we make a decision on it. Thank you.
Thank you, Councillor. Just a few points to come back on. It isn't our decision whether this closes or not, so we're not making that decision. What we have done is reviewed our EHCPs, and I completely understand your point about October. We tried very hard to give as much notice as possible to the school, and that did mean looking at the previous reviews that those young people had had. In the first instance, if we had waited till phase transfer, it would have been a very short period of time for both the school and the families. We tried to work with the school and with the Partnership Trust to get as much information to families early and open those conversations early. Unfortunately, it didn't actually work for us. The Partnership Trust went through their processes and didn't want to speak to the families earlier, and that's why it came around to January, February time by the time we had those conversations. But you can understand also they were juggling what it would mean to their staff, and it is a very, very difficult situation. So we respect the work that they did, but we did try to open these conversations earlier. I think there's just a couple of points around climate change. So we wouldn't expect these young people to go into residential provisions now, and so that's why we wouldn't be driving them out of county. We're not expecting their schools to change. They'll stay in their day placement at Fossway School. And we do appreciate and thank Fossway House for the incredible work that they have done. A lot of those people working at Fossway House are now going to be working within the school, so they haven't lost their expertise. The expertise is moving over, for the most part, not everybody, but for the most part, those colleagues are moving over to the school, and the school will work with them to make sure that that expertise is then used during the day. And so you mentioned about food, etc. You know, we would expect them to have that as part of the school day. We absolutely don't want and never want to go to court. To have to make a decision, although it's there for us if we need to. Mediation is the first way forward when there's a disagreement, and we have had conversations with our partners in Sendias, with the school and the Baines Parent Carer Forum to ensure that the right support is there for parents who do need to talk to us about this. But I know that it's really difficult. I know that it's really difficult for them. I'm not saying that their disabilities have disappeared all of a sudden by any means. What I'm saying is that within their EHCP there are lots of different ways in which you can meet that provision. And when you read Section F, although you could write it to say that it has to be a residential, you could also write it in 100 different ways. And I do believe that those needs can still be met during the school day. A cost-benefit analysis, I think, is difficult, but we can certainly take that away and have a look. The majority of young people who go to Fossway House do go on to residential college settings afterwards. And we're not saying that residential college settings might not be right for those young people when they leave Fossway. And so there are a number, not within the local authority, but depending where you live in the local authority, can be very close to your home, of really established post-16 settings where there is a residential element that we can move these young people onto potentially in the future if it's right for them and if their plans match that, and that will be done through the annual review process. And also our colleagues in adult social care work really closely with us for transition to adult social care when it's appropriate. So it might be that the most appropriate thing is to go into a long-term residential setting that's your home, rather than a setting that will be for a couple of years and then you have to move again. And so we are working with adult social care to ensure that people can be settled, rather than Fossway House for 2 years, a college for 2 years, then looking for a long-term home for that person in the future. So I do understand what you're saying, and like I said, I will take away the cost-benefit analysis for this and come back to you with that as soon as we can.
And perhaps we could ask our Cabinet Member to include an update in his next report on Fossway House and how that is going. With that.
Well, I think it may be too late because they don't have any choice. You know, as I say, it's the same as Newton House, where we're told, you know, there isn't the need. People don't come and ask for the service, but, you know, do people know about service? That's the big issue. Again, we're going through the same things we had before. A decision's been made, and then we're told what it is, and this will go to Cabinet and we'll agree it, and then we'll get a report in June or wherever it is to say, well, you know, this is what we've done. We don't have the full facts in front of us. And I would like to ask, how does this fit with our corporate strategy, which says it's going to support all people across Bath and North East Somerset? Because clearly it doesn't. And if you look at the Equality Impact Assessment, which only picks up 3.1, it's not been really specific under 3.5, but I don't see any evidence being included in that Equality Impact Assessment, and I don't see any actions on how this is going to go forward. I'm sorry, it's not a very good EIA, once again.
So there aren't any actions moving forward, save to work with the families to ensure that the provision is right for those young people. You know, we've got a decision through our process in line with the law and previous case law around how to place young people in schools. As councillors, you don't monitor how many young people I place in any other type of provision, and so it wouldn't be usual for me to come to you and say, I've got no children going to Sandwell School this year, for example. That wouldn't be something that we would discuss here. We look at the individual needs of the pupils each year through our placement panels, through multi-agency decision-making, and make decisions that are best for each young person across the local authority. I think it's a good point that you make around across the local authority, because one of the challenges is that the places there are only for young people already at Fossway School, and we're not able to open that up to other schools. So it doesn't serve from across the local authority. It serves young people who are already in attendance at Fossway School, which I think is an important thing that we haven't been able to move beyond. But you're absolutely right. The Partnership Trust have had to move forward, knowing that there are no places for September, and so that's the position that we are now in. They have spoken with the staff and they're finding alternative roles for them, and so that isn't a decision to be made, that's a decision that they have made for that provision.
Thank you. Liz and then Ruth.
It has occurred to me, when you said, and just confirming this, Laura, when you said that there could be and might well be provision for education, accommodation for some of these young people post-16. So I'm just wondering, if there was this residential accommodation for them pre-16, would it not help them move forward, and maybe there might not be the need for the 16-plus accommodation wherever it is? I'm assuming it's probably out of county.
There are a couple of residential colleges that are very close to county, but they are outside of county, Wiltshire and Somerset. It hasn't been our experience that residential at Fossway House leads to a young person returning home after Fossway School. It almost always leads to a residential college provision for those young people, which has a different focus on education, as you can imagine, as a post-16 provider. But also that young person hasn't then lived at home for quite a long period of time, so resettling them back into home is really difficult, even if their needs would suggest that they could go back home. That can be a very difficult thing for us to manage with families. And so there are many occasions when they do go on to a residential setting or onto adult social care provision, so they don't return to a house necessarily. But of course, these are all individual cases. And so we could report on that if necessary, but I'm not sure that would change decision-making that's happened.
Thank you, Laura. And I suppose the key here is that it's about having the right provision for each individual child, and if that provision isn't needed, we can't create need, can we? Ruth.
Thank you. Yeah, I can. But I'd just be interested to know a bit more about the Partnership Trust's motivations as well. Do you happen to know what they're planning to do with the house, the actual physical building, and once this facility is sort of no longer on offer, and is there any possibility that it could be then reinstated for that use at some point in the future? Because it does seem, you're looking at this on, next year's kind of demand, as it were, but things change, don't they, over time? Could it be do you know about that?
So the Partnership Trust, so it's their decision-making around what they do with that space. As a local authority, we have some ideas of how that space could be used, but it is ultimately a decision for them. I think there are a number of things they would consider moving forward once this period of time is over. So, for example, it may be that more day placements could be made available at Fossway School by repurposing those rooms. It's a possibility that we haven't agreed with the Partnership Trust, but now we've got about 100 children waiting for school places at the moment. That could be a good use of that space. Potentially, or they may decide, as you're saying, to keep it as it is in the hopes to reopen it or under a different guise in the future in some other way. They may have some plans around that. The Partnership Trust would be able to better answer that, and I can certainly ask them. I think at the moment their focus is on now and working with their colleagues for what happens to those employees who, as you said, very, very valued, very experienced employees, and what happens with them moving forwards in terms of where they're working and their terms and conditions, etc.
Thank you. And I'm sorry, the employees are all going to be under notice. They're all going to be made redundant. So that's probably jobs going out of the area. We've got enough out commuting as it is.
From what Laura said, I thought they were being redeployed.
So the vast majority are being redeployed, but they're still doing that work at the moment. As many of you will know, it's incredibly difficult to recruit into schools at the moment, and the Partnership Trust are working really hard to distribute those staff into other schools, including Fossway. And Fossway did have a number of vacancies that they were hoping to be able to fill from those colleagues. But I can completely understand it's a different type of job, and so whether that is something that those people feel they want to do or move on to other things, that's obviously something that the Partnership Trust will work through. But my understanding from speaking with the head teacher was that they're feeling really positive around keeping the expertise within the school moving forward.
Thank you, Laura. I'm sure we all appreciate it. It's very challenging for all concerned. I just wanted to pick up on a point that Leslie made, and I think we've made it on and off throughout a number of different meetings, and that's accessing what help is available, including, through our own website, through the Live Well part of that website as well. And I just wondered whether, and I'm not necessarily saying this is a question for you, Laura, or indeed for any of the officers, maybe it's something that a Cabinet member might want to pick up, but I think there is an ongoing issue with people knowing what help is available, what support they can have, because I don't think our website is as intuitive as it could be.
I agree with you that our website is difficult to navigate. The teamwork to Live Well team work really hard on that at the moment in order to try to improve things, but I completely agree that there are more improvements that can be made there. What we've been trying to do is have our drop-in sessions with the Parent Carer Forum. So, for example, there was one for adult social care just a couple of weeks ago. I know that Fossway School held an information event there not that long ago that again was attended by Baines Parent Carer Forum and colleagues from my team. And so we do put information, sort of drop-in sessions around the county, but I would be very happy to look at that further and see how we can ensure that our parents and carers are getting as much information as possible, because there is a large amount of support available, but like you said, it's quite difficult to navigate at the moment, so I couldn't agree more.
Sorry, Jean, if I can add, you're absolutely right around the Rainbow Resource and the extent to it's intuitive. And I was with Rachel Hale from Baines Parent Care Forum. We were on a preparation for adulthood away day, and we were looking at that. And so our Live Well team is looking to extend, as I've done for the autism pages, to have working groups with parent carers and young people involved to look at how we can continue to make sure that site is as up-to-date and intuitive as possible to increase the accessibility, because there's all those things that parents need to know that they can have access to, for example, the travel training that we commission, all of those elements that make life better for the future for young people, that we want to make sure that they can access all that's out there. So that is definitely a work in progress.
Thank you. Maybe we can ask for a progress report at some point. Thank you. Right. We now move on to the Youth Justice Plan.
Sorry, Chair, can I just say, I don't wish to accept this report. I just want it recorded in that, because as far as I can see, it's institutional discrimination. I just wish that to be noted. Thank you.
Okay, I'm sure your point will be noted. Okay, we now move on to the next item, which is Youth Justice Plan. And Paul, do you want to introduce this? And then I assume you're going to pass on quickly to Carla.
Thank you, Chair. Can I just stand back for a second, because we agreed a 2-year forward plan through the democratic process, so it came via this committee to the Cabinet, to the full Council, and it was approved unanimously at the full Council. And this is a slightly different approach, because in the past, I think, we've done a plan, and then we do the next plan, and then we do the next plan. And this is a slightly different approach, and that is that we're actually feeding back information for scrutiny at an early stage, so that you can actually look at the detail, what's going on. So from my point of view, I'm pleased that it's such a full report, and I'm sure the scrutiny will be really good at this, because I think in terms of people who live in this area, it's important that we do recognise where the risks are. And if you remember, in the original document that was approved, there were 2 priorities. One was around SEND children, and one was about equalities. But the whole approach is really, really different now, because we're talking about the child. We're not talking about youth offenders. We're talking about children. So it's a major change in the way that this is being dealt with nationally, but also locally, because it is important for us, I think, to recognise this is our community, these are the issues that are going on, and how we can best deal with them moving forward. So at this point, I'll hand over to Carla, who's in an interim role, which I'm trying to make sure that we can get that confirmed as soon as we can. So over to you, Carla. Thank you. Laura, thank you.
Thanks, Paul. Yes, my name's Carla Cooper. You may remember I came to this panel last year to present our 2-year youth justice plan, so from 24 to 26. And I'm here today to provide a progress report about that, and hopefully you've had an opportunity to see the presentation that I submitted and our equality impact assessment. So I think it's been a successful year for the Youth Justice Service overall. I want to initially draw your attention to Her Majesty's Inspector of Probation inspection that we had last year. And the report was published in February this year. We had an overall rating of good, with 3 areas that were outstanding, 9 that were good, and 1 that required improvement. And I think you can see from the link that I've included in the report that the inspection report was really favourably written. It's really recognised some excellent areas of service delivery, and reflecting that the outcomes for the children that we work with in our service are positive. And so I think that's something that we were really pleased with this year. There is a small improvement plan which we are working through with our partnership board and within our team, and we're making some good progress on that. And in our refreshed plan for this year, those will be sort of some of the cornerstones of the work that we're looking to develop. So you'll see in my presentation, I've given a bit of an update on our performance indicators.
We have three main performance indicators. One is the rate of custody, so that's the number of children who have been sentenced to custody in any year, and you will see from this that we are performing well in that area, and we have just had one child sentenced to custody in the reporting period that I mentioned, and our rate is lower than all comparators. You'll see the update on the first-time entrants. In the last year or so, we have seen an increase in the number of first-time entrants. That is children who are coming into the formal justice system for the first time. We have done a lot of work locally to scrutinise the increase there and try to understand what's happening and whether we have taken all opportunities that we can to prevent children coming into the formal justice system where possible. And we have made some recommendations around that. There are some changes in practices around work with the Crown Prosecution Service, the police and courts, which we hope that we'll see a reduction in that in the years to come. And our other performance indicators are on reoffending. So those are children that have had a substantive outcome and have entered the justice system. And then the reoffending rate is looking at how many of those children have offended again, and of those children who have offended, how many offences did they commit. And you'll see that in both of those indicators, we've got really strong performance that is better than our comparators, which indicates to us that the children coming into our service are receiving a good service, and we're pleased to see that their reoffending is low. You'll see from the presentation that we had for our two-year plan 4 key service priorities. These were around reducing disproportionality. That is for children with overrepresented groups, which are children from special educational needs and children from minority ethnic backgrounds. Our other priority was around strengthening participation, so making sure that we consulted children, parents, carers and those harmed by offending, and look to co-create and develop the service with them. Our priority has also been around embedding child-first principles. This really has been the cornerstone of our approach. It's a nationally recommended approach, and it's something that we've really sought to embed in our service. And the other priority is around reducing serious youth violence, and we know how important that is to support children and for them to feel safe in their communities. So I shall just provide you with a brief update around each of our areas of priority and what we've worked on in the past year. So in terms of reducing disproportionality, our aim has been to understand and quantify the disproportionality so that we can monitor it, and then ensure that all our work is culturally competent and meeting individual needs. And we are wanting to ensure that our workers are well trained and well equipped to meet the individual and diverse needs of the children that we work with. And that we also work in a preventative way with education colleagues to ensure that those overrepresented groups are reduced in terms of coming into the formal youth justice system. So we're seeing some good impacts in this area of work. That was particularly noted in our HMIP inspection, in that the inspectors felt that children who worked with our service, their individual diverse needs were being addressed and met through the work. And we are seeing increased staff confidence in enabling children to talk about their identity and interventions with children with special educational needs. And so then looking to the future and what we're going to do in the year to come is we are going to continue with this priority. We're going to continue to audit our work to ensure that our standards are high. We'll continue to promote early help activity for overrepresented groups. We are also looking to develop some educational psychology input into our team so that any children whose needs have not yet been identified, we can seek to get them support as early as possible. And we are looking to refresh some existing policies to ensure that they do sufficiently cover equity, inclusion and diversity. And that was something that was recommended to us in our inspection. In terms of our participation work, we have done a lot to strengthen participation, whether that's through our reparation work, whether that's through children being on recruitment panels, asking the views of children and parents and victims that we work with, and we have recruited and trained a new small group of community volunteers and mentors. So those are things that we're really pleased with our progress on this year. And in terms of the future coming year, we are looking to develop parent-carer drop-in sessions to make sure that we are finding a range of ways to hear the voices of the parents and carers that we work with. And we are developing our participation strategy so that we can draw together all the work being completed and identify if there are any gaps moving forward. And then with regard to our work on embedding child-first principles, we have worked really hard at embedding trauma-informed practice into our work. We're raising participation and aspirations for children through E2E support. We're taking some actions to ensure that our reports are more accessible to children, and so that we're writing referral order reports directly to the child, hoping that then they will feel more part of that process. And we're also doing some more strategic actions around looking to ensure that the delays in the criminal justice system are addressed at the right level. And so that's work that we've started this year. In terms of the coming year, we're planning to continue to work to reduce the episodes where children are held in police custody, and working with our police colleagues, social care and the emergency duty team colleagues to ensure that that happens. We're continuing to work at a local criminal justice board level around the timeliness of justice and ensuring that a child-first approach is taken in all criminal justice agencies, including the police, and encouraging other organisations to undertake the Child First self-assessment that the YJB have created. And then our final priority is around reducing serious violence. And the work that we've been doing around that is making sure that we are evidence-led. And you might be interested to have seen in the information pack that with this report was the Youth Justice Board's Knife Crime Insights presentation, which I think has got some really interesting information that we can learn in terms of our service provision going forward. Making sure that we're future-focused and strengths-based with the children that we're working with. That is seen to be the most effective way of working with children at risk of serious violence. And the other great achievements of this year is that we've really shored up our risk management approaches and our joint working with children's social care, so that for those children who are most at risk, we are working using the same language, the same sort of templates and meeting structures, so that we are talking the same language and working really strongly together to protect and safeguard the children who are most at risk. And then in the year to come, we have an aim that we're going to be building on our support offered to victims, in particular young victims, and that we are aiming to complete a partnership-wide review of activity around work that's being undertaken to reduce serious violence, including the impact. So that's an update on our priorities, the work we've done and what we're aiming to do in the coming year. You'll see in the presentation pack that I've included a few snippets of some of the feedback that we've received from children and parents and carers, and I think you'll be pleased to see that there's some really heartfelt praise there for some of the workers and the support that we've provided to children and families. So I thought that would be good to include. And then finally, I thought I'd take this opportunity to provide a brief update on the work of the Violence Reduction Partnership, to let you know that as per the Serious Violence Duty, we have completed a strategic needs assessment. This is not been published because of the protected data that is included in it, but we are working on an executive summary that can be published, so look out for that, and we will send that round to all colleagues when that is created. And we have submitted a delivery plan to the Home Office for their approval for the 25-26 year. This plan was created with the partners of the Serious Violence Steering Group, and we will be continuing to commission some services, including detached youth work, lived experience mentoring, the alternative routes workshops that take place in schools, and the parent care and lifetime awareness events. Our work plan is to continue to engage with the community, including a survey for children and young adults about knife crime and serious violence, and increasing engagement with schools through workshops and inclusion panels, the Race Equality Task Force, and Reducing Exclusions Group. And continuing to build links between the Violence Reduction Partnership and education teams, SEND, and the AP Advice Service. So, please, any questions?
I think Paul either has a comment or a question.
A comment and a question. The comment is that I've seen the partnership working, and it's been really quite refreshing seeing with a new person in charge of how that's actually working effectively across a number of partners, because we've had discussions in the past about funding, but the police in particular have, I think, improved their contact with us and working more effectively with us. But the other thing is that I've seen the team working with young people and their commitment to young people. When a young person comes into the system, they get allocated a member of the team and they stay with them. And I've seen that in the partnership meeting. We have, individual cases that are reported, and it's quite clear they build up a relationship with the young person and their families, because sometimes the assumption is they come from a broken family, but that isn't always the case. And I think it's important that these people actually are working with the young child to help them through many other problems outside of just the justice problem. So I think it's important that we actually do see that the performance figures, which are really good in terms of Bath and North East Somerset, which I think is really reassuring for families, but also that's because I think a lot of hard work by a lot of people, including HCRG, which we had the discussion about earlier, but they're really active in this partnership.
Thank you, Paul. Okay, so now we'll turn to the panel for any comments or questions. Kevin first, and then Liz.
Thank you for your report. A couple of things. First is very quick, because it might be a similar situation to the virtual school funding, but you mentioned on page 63 of the pack, it says that turnaround funding was going to cease in March 25, and just to see whether that is the case or not. The next question is around, on page 75, 76, you looked at the national priorities and some Baines figures to do with how well things are going. Couldn't see any figures related to looked after children, although I may have missed that, or children looked after. Page 81, great to acknowledge the great things that education are doing, obviously in supporting the work. But I just wanted to raise the point around the fact that schools aren't necessarily in control of everything, and that obviously with the public health work at the moment on wider determinants, I just wondered where that fitted in to your plans. There were at one stage, and it must be more difficult now, when Bath and North East Somerset was an authority that maybe didn't have the mapped landscape as well. But you seem to put a lot of store on trauma-informed practice, beg your pardon, and the support it offers, and whether that's something that is going out across all services, and whether that is something that you have any control over or that people want to do. And just in relation, the last couple of points, in relation to that, the role of MAT CEOs within your structures and decision-making structures particularly, as one of the points from a little while ago was Matt CEOs asking to be involved in those key decisions that involve children in schools. And lastly, youth hubs and where that might fit into the good work you're doing.
Thank you, Kevin. I will aim to address those questions, but forgive me if I haven't noted all of them down. I might come back to a couple of them for clarification. But the first one is you asked around the turnaround funding. So at the time of writing last year's plan, that was due to cease at the end of March 25. But we have had some continuation of funding from the Ministry of Justice. Unfortunately, it is 2/3 of what we had the previous year. So there is a reduction there. But we are able to continue to offer some level of service for turnaround. So, yeah, disappointing that we have had a reduction, but yeah, in some ways good that it does still continue. But it is only in other 12 months funding that we've been issued with. So once again, we will be kind of watching and waiting. I think we were informed mid-February that the turnaround funding would continue, so we're often getting quite late information from central government about that. In terms of the looked after children in the annual plan, that is, I think we've got some data in there perhaps about the overall rates in Baines, but not around the children who are involved with the justice system. But actually, interestingly, in our refresh plan for this year, that is something that we're going to include. I haven't got that for you off the top of my head. I think that we do see an overrepresentation of children in the justice system who are in the care of the local authority, though, certainly compared with the overall population. I think your third question was around our involvement in the public health work around wider determinants, and is that also about the free school meals gap, that piece of work? Are you talking to? Yes, so I am involved in in that work, and I think I certainly was involved at the beginning of it when they were scoping out and wanting some input, and I am due to link back in with Becky George about that going forward.
I think if I can just help, I think you're referring to the presentation we had from Amy McCulloch around, and that was around that your children are at school for 24% of their time, so that left for 76%. So I think it's a really good point, and we'll follow that up, Kevin.
And your fourth question, I think, was about trauma-informed progress, and it's trauma-informed working, and it is something that we're really passionate about in youth justice. Certainly, we know that if we don't understand the trauma that children have been through, we might be seeking to intervene with them at a stage that is not suitable for their developmental, cognitive, emotional level. So we need to make sure that all of our interventions are matched where the child is at. I know that the children's services more widely also are very trauma-informed in the way that they approach things, certainly children's social care. And I know that there are some initiatives in schools, but I can't comment directly on those around trauma-informed schools that I think the virtual school were doing a lot of work on. So I don't know if you need any more information today on that.
The virtual school led by Sarah Gooder leads on also attendance and exclusions as well for the local authority, and she has developed quite significant tools and training around trauma-informed practice, and she works with those schools and trusts who want to work in that way and take that forward. It's not all schools in Baines yet, but we are hoping to try and get as many schools involved as we can.
And can I ask for clarification on your fifth question about MATs and CEOs being involved in decision-making?
Yes. This may be me, because when you read a long report, you might necessarily miss things, but you talk a lot about the educations and the Director of Education being involved in particular structures within the youth justice system of the Youth Justice Board. And I just wondered whether consideration is being given now to maybe the actual CEOs of MATs being part of those structures, as rather than just being something that may be consulted with on an additional bit. But they seem to be saying, or at least Alan Williams was, why am I not part of those key structures where decisions are being taken rather than being consulted with afterwards, because I actually control these 34 schools in my trust, if that makes sense.
Sure. Thank you. I think that's an excellent point. We do have the principal of the Bath College sitting on our Youth Justice Partnership Board, so in that respect there is an education representative there, but I think that's something that we can take away, Chris, isn't it?
Yeah, it's a bit of a conundrum in Baines when somebody wants an education representative on a board or a strategic partnership, because no one person represents all the schools in Baines any longer. So that is always a challenge. So but we work through it. So the last School Standards Board, Carla came along with the education work and presented a report on youth justice to the Standards Board, so CEOs could see the work that we're doing around education. And we do try and involve CEOs and trusts in relevant bodies where we can, but it is not always easy to make sure that they're able to be represented in all schools. So what we do try and do, and what we do now, is take partners to the School Standards Board. So we have a slot on the Standards Board for the police, a slot on the Standards Board for the ICB colleagues to go and talk about health matters, and then we have other partner colleagues. So Carla came there last time. Where we've got round it previously is we have representatives from the School Standards Board who will go on to certain bodies like the Safeguarding Partnership, and then they're expected to feed back to the Standards Board. We have talked previously about having a education rep on the Youth Justice Board, haven't we? We're trying to get around that, but it's not easy to get one to represent all of them. So I will tend to take that back and then take information back to Standards Board. Sorry, long-winded.
And your final question, I think, was about youth hubs. So we are awaiting specific guidance from the government around youth hubs and the prevention partnerships that we are going to be expected to set up, but we haven't received specific guidance yet. So we are waiting for that. But I'm of the understanding that the prevention partnerships are going to be rolled out via the violence reduction partnerships.
Thank you very much, Carla. I think you've answered all of Kevin's questions, so I will now ask Liz if there's any further questions.
Well, Kevin has touched on one or two areas I'd like to ask questions about, but they're mainly to do with two things, two areas. One is about finance, and the other is about disproportionality. So firstly, Kevin mentioned about the turnaround budget, and you've replied that you're getting two-thirds of, it's something like 58,000, I believe, so you're getting two-thirds of that. And on page 181, you say you're going to run out of money. So what are you going to do? Because it looks like you don't have enough in your budget to run the Youth Justice Service. Now, I may be wrong, I may have misread it. It was a very long, thorough report. Many, many thanks for that. So that's the first area. And the second area is disproportionality, especially looking at special educational needs. But I'll go into that in a bit more detail in a minute.
So thank you. Yeah, you'll see that there is, towards the end, I think one of the appendices is the overall Youth Justice Partnership budget. And the one area where we are at risk of being overspent is one, actually in some ways, quite small part of the overall budget. So we have seen a reduction in the turnaround funding, and that has unfortunately led to some reduced hours for a member of staff. The pooled budget, which is the budget which is at risk of being overspent in the coming years, is the combined contributed budget from all statutory partners, and their contributions haven't increased for a number of years, but obviously costs continue to rise. But I don't want people to be alarmed. That isn't to say the entire youth justice budget is at risk of being overspent. It's just one part of it. And so we will need to address that. We've put it on our risk register. It's something that the partnership are aware of, and that we will keep them briefed on that and make sure that there is activity and decisions down the line when that becomes much more of an issue. So we've highlighted it as a risk, yes, but it's not to alarm you that it's the entire budget that is at risk.
That's reading it too quickly, but thank you for that. And obviously we need to be asking our partners for more money, apparently, I would think. Just as an observation, they ought to be contributing more. We contribute the vast amount. Anyhow, that's that question. The next one is about disproportionality. Now, it comes up every year. I haven't been a councillor for some time. It comes up every year about disproportionality with our children from Black, Asian and other minority ethnic groups, particularly mixed ethnic group. And I see that there is an action plan where you've got progress being made in the anti-racism plan that you've got. So I believe you are tackling that. But the one that really stands out to me is special needs. So looking at your information, I mean, it's incredible that 81% of our young people involved in the youth justice service have either attended special schools or on AP schools with alternative provision schools. I used to be a governor at Aspara, so I know all about them. And that there are only 19% of mainstream school pupils in the joint in the Youth Justice Service programme. Now, this is incredible. So I've got your action plan in front of me where you're going to work with inclusion managers and the SEND strategy group to address disproportionality issues for children. And you, Carla, you're attending Inclusion Board and Supervisions on Exclusion Steering Group to address this area of disproportionality. Because linked in with special needs, there's also things like many of these children have been excluded, repeatedly, or have been permanently excluded. There's low attendance with these young people as well. And I'm just looking at what else there is there as well. So there's a whole lot of school-based issues which are beyond your remit, but you end up with this cohort of children, young people, who are involved in a youth justice service but have huge educational school needs. And I just wonder, is there a better way forward to tackle the young people that we're getting who are falling through the educational net? They're not attending school, they are being permanently excluded, they've got special needs, so they are attending special needs schools, but the bottom line is many of these are now offending. So I just wondered, to what extent are you being able to work with schools? And as I said, you receive the outcomes of what's happening, the low attendance, the exclusions, but these young people share a common denominator in that they have school issues. So I just wondered what your response would be to that.
I mean, it's certainly true to say that the children who are in the justice system are some of the most vulnerable children in our communities, and the presence of additional needs is one indicator of that. I think we would say that we have seen a big increase in children in the justice system with special educational needs and additional needs over the years, and in part that is because more children's needs are being identified now. So perhaps if we were to look at our figures going back 5 or 10 years ago, there would be much lower rates of children with SCN in the justice system, and that's because perhaps they were children who did have those needs, but they haven't been identified. So I think there's something there about the figures. But it is a real concern that some of the children with the highest level of need are ending up in a justice system, and we can see that represented in the adult prison estate and offending figures too. So it is important to ensure that we, as a whole children's service, work with children in a preventative way and look to include them in provision wherever possible. But, yeah, I don't know. I work closely on a preventative level with colleagues, as well as, like you say, when perhaps the outcomes have started to become less favourable. But certainly when children reach our service, we do everything that we can with partners to ensure that their needs are identified and met where possible. And, you know, we do have some good successes of doing that as a partnership. But in an ideal world, we would have prevented that poor outcome in the first place.
So as a follow-up to that, Chris, I can see you're about to talk. I was going to say, so we're expecting everything from schools, aren't we? That they're going to solve all the problems of the world, and they can't. So I believe you're going to add a little bit more to that.
It's just to say we work in partnership in children's services across a range of services that we provide to our schools in Baines. And we do a lot of work to reduce exclusions, we do a lot of work to challenge exclusions when they happen in schools, and permanent exclusions. When you see the annual data again next year, you'll see that's come down again through the work that Sarah Gunnar leads on. She leads on that area of work. And we commission a lot more services than we ever used to do around additional support for schools. We are currently providing the Send Napier advice service now, so we're providing more support and advice to schools than we ever did before. And we're also reviewing the inclusion panels to see how they can work more effectively schools. We're really conscious of the disproportionality, particularly our black children in schools, and we also deliver what I think is quite a groundbreaking race equality charter mark with our schools, which all of our schools are signed up for. It's led by Jason Pegg in the Black Families Education Support Group, and he'll describe it's probably the best work he's been involved in the work that he's done in Baines recently, and he's been working in Baines for 20 years, and it really are trying to support schools to do that. But schools can't do it all. If my school's colleagues were here, they would say, well, who's going to help us with the families when they don't attend? Who's going to help with that? So I do see the view from what schools have. It's an area of work that we'll continue to work on to provide more support around schools and to put more challenge into schools as well, where we think trusts should be providing more support, and that's an area of work that we're looking at the moment. But we do have a cohort of children who are overrepresented. I'm pleased to see that overall the numbers are children in the youth justice system are going down, but the children who are there do have educational difficulties, and we need to keep working on that.
Thank you for that. And it's reminded me that we do have a youth offending team, which obviously tries to identify, I would hope, would be and people who young people who are going to enter the youth justice service. So are we identifying young people early enough? Is that a piece of work that we could be doing, identifying young people who are in danger of entering the youth service, the youth justice system, before they get involved? And you know the indicators now, you know, special needs, etc., low attendance, being permanently excluded from school. But so is there a way of identifying young people earlier?
There are certainly a number of mechanisms for identifying children who are at risk of entering the justice system. One of the mechanisms is our partnership to reduce exploitation and violence, which is the joint group run by the Violence Reduction Partnership, Police and Children's Social Care. And that partnership receives notifications from a range of partners, from potentially community members, but children who are coming up perhaps on the periphery of issues with the police, or siblings perhaps of children that we're already working with. And that group is responsible for identifying those children and ensuring that their needs are responded to. So perhaps by making appropriate referrals and ensuring those children are linked in with preventative services. We do have the Compass Prevention Service as part of the Youth Justice team, which is a really valuable provision. and we receive mainly referrals from schools in that respect, so children who are coming to the attention, perhaps they've had some suspensions, and so we're just really keen to make sure that that service is being used for the, in the right places, given that it's a limited service. Our turnaround service that we've mentioned, that again is another service which looks at children who have had some kind of brush with the police. They haven't had an outcome, but they have come to the attention, and so we're able to offer children and families a support service on a voluntary basis there. We're also involved as a partnership with the Antisocial Behaviour multi-agency group, and that group receives referrals from police who are perhaps out on the beat and identifying children who are at risk or perhaps involved in some low-level antisocial behaviour. So that's another mechanism where children can be referred into a multi-agency group to ensure that their needs are identified and met. And of course the prevention partnerships, which is the new government initiative to be developed in the coming year, it looks to build on that. So any child that has had a no further action from the police is due to be offered some support from the prevention partnership. And so we're looking to see how we will develop that once we get our national guidance. I think what we will need to do is bring together some of the existing groups that we've got and feed them into one, so that we don't have too many different forums and it can be too confusing for professionals and the community. But there are a number of ways that we seek to identify children who are most at risk and most vulnerable to getting into trouble.
Many thanks for that, and maybe a flavour of that could be in the report, that there's an awful lot out of there to identify young people who are going to enter the youth justice system, and maybe there are far fewer. And it's good to see the reoffending rates are low, because maybe all of this work that's been doing. And one final thing to say, do please give us information about children looked after, because the numbers of them I know are very small in the youth justice service and the youth justice system, but we do need to know about them. Thanks.
Okay, so I've got a steadily growing list. Next on my list though is Leslie, and then Joanna.
Yes, thank you for the report, which is vast. First of all, Paul, you talked about working with HCRG. Can you give some examples? Because it was a bit of a broad statement there, so it'd be nice to have some examples. I want to say, Carla, to you, having been a councillor here for 2 years, it's the first time I've seen any actions on the equality impact assessment. So you must be totally congratulated for that, because you're the only one that's managed to do it so far. Which doesn't say a lot for anybody else, really. So picking up also on the figures, and echoing what Liz Hardman has said, if you're looking at the educational needs disabled children, we're looking at 15%. This was up to 2023, compared to a national and regional figures of 9% and 8%. So it is much bigger. What's going on in Baines? We've heard from Naomi this morning and the support work she's doing. We've heard about some of the work that goes on at Fossway House. It's just a drop in the ocean compared to what seemingly we need. It's also interesting around the figures for ethnic people. So again, we've got a very high number of non-black people, but we've got a very disproportionate amount of black children that are coming into the youth justice system. And it'd be good to hear in future of some of the initiatives being put in place to try and counter that. And I think I went to the Violence Reduction Partnership Conference earlier this year, and there's some great work going on from Baines, and I said before, and I hope we can see that, there's some, it'd be good to see some of those reports coming through, rather than having a massive report next year. It'd be good to see something in between, because I think this is really important. I don't want to reiterate what Liz has said, so I won't, but on the impact assessment, you have mentioned gender reassignment, And again, there's a link there with gender reassignment and neurodivergence, which tends to be quite high in that community. And there does seem to be a negative impact on this, and it'd be useful to see more happening in that area, especially when we've got an issue coming through which doesn't preclude that work can be done. It's a bit of a Section 28 moment. And EHCPs, you've talked about in the impact assessment, waiting lists can be problematic because they're taking a time to come through. Can you give us any assurances around how these are going? It's probably not your responsibility, but any assurances about how the waiting times can be reduced? Thank you.
Whilst Carla's getting ready to answer those questions, I made mention of HCRG because Val Scrays, after Mary left, has taken over temporarily the chairmanship of the partnership, and she's really active and involved in the partnership working. So it was perhaps I shouldn't have made it as a throwaway comment, but I think I've seen that she's really positive in the way that they're dealing with this.
I can say that in the Youth Justice Service we do have really close working relationships with HCRG, in that we have a school nurse embedded within our service and a speech and language therapist, and HCRG have been involved with training some of our team around neurodiversity and the neurodiversity pathway to ensure that our teams are well equipped to deal with children who have got a range of additional needs. I don't know, Chris, did you want to speak about the SCN and the EHCP waiting times?
I can't comment on the data. I don't know specifically which data we're looking at, but I'm assuming it's local and national data, Southwest, in terms of levels of that. So I don't know which specific data that is, and I'm not able to comment on that at this stage, but I'm quite happy to look at it if you can show me where that is. EHCP waiting times, as I said at the beginning of the conversation, in response to we put in Paul's report, we have significantly invested in the number of new practitioners that we've got in the SEN team, and we've got more staff coming on. I'm confident we'll start to see those waiting times improve for EHCP assessments, and they already are starting to improve, so I'm confident we'll get those back to where they want to be. We've got a link between the SEN team and the youth offended team as well, where we are always trying to make sure that we're focusing on those children who are most vulnerable.
And Leslie, I could also circulate our anti-racism action plan. It is something that is on our website, but I can certainly circulate an update. We've recently updated the actions and activity that, so I can make sure that you guys get a copy of that, if that would be helpful.
Yeah, I have looked at that on the website, but it'd be good to see an update, and I think everybody might like a look at that. Thank you.
Paul, would you like to turn your microphone off unless you're going to speak? That's okay. So Joanna and then Ruth.
Thank you for your hard work on this. It's really interesting to hear about SEND and EHC. I always get the letters the wrong way around myself. ECHPs. I've literally just read a book by Robin Ince called Weirdly Normal and Unnormally Weird, about being diagnosed in his 50s with ADHD and the impact that then has across his life and realising it. So I do think that there is a wider issue that we are now diagnosing more than we ever used to, and then how does that sit within the social structure? So as a local council, we have a lot more young people to deal with, and I hear that there's a backlog. And that is because how we view things has changed, and the prism of that view has changed. What also appears to me to be a case is that some parents are better at going through that system. And let's be honest, the middle class parents are the ones that are very good at doing that, because they already can essentially read and write and know the system and the pulleys that you have to go through to get change. So I'm just thinking beyond this, and I'm looking at the Labour members in the room more than anything, because you're the ones in power. We've just seen how the early years funding agreement is there, and that you're wanting to bring in free school meals, etc. But what there doesn't seem to be is a proper place to take parents through the system, and then we're saying, oh, it's up to the schools to sort it out. Whereas we recognise that being young and going through childhood and getting to be an adult is a different process, and that there are all kinds of neurodivergent people in the world that need to be supported in a way that we've never recognised before. And well done to us as a society that we now see the world like that, because quite clearly when I was a child you were told to sit down and shut up, and you got whacked in the process. That did not help. Councillor Paul is laughing because he remembers it well. So I guess what I'm trying to say is here, this is an amazing report which will go to full council in July, but I'm just wondering if we should put in a recommendation to government that we recognise that there is a different way of seeing things, and in that process of seeing things, does there need to be a better system to support parents who don't have the ability to go forward and challenge the system because they just don't have the capacity due to employment, funding, people around them, etc., and they can't. And therefore, those are the children that often fall through the net that we now see in the social justice system. So I throw that into this room. I'm not expecting an answer or anybody to wave a magic wand, but if I don't say it out loud in this forum, where do I get to? So that would be my consideration of what everybody's been saying, what I can see from the various spaces that I divulge or get into. Okay, in terms of the report, I have a question on two things. How many youth workers do we actually employ in the Bath and North East Somerset area? Because, for instance, we talk about antisocial behaviour, but we know the figures, which are probably limited, that, what were they 20 years ago and what are they now? And is there a real impact? Because that is a sizable thing to look at. And that has changed, and that has changed over time. And also, on page 22, just to pick up something tiny, it says, in terms of staffing, Avon and Somerset Police contribute one, the probation service contributes something, and then it says, although the post has not been filled for over 3 years. Now, I'm sure that tiny post over 3 years does not make a difference to the whole overall story that we're talking about here, but it's like, okay, every bit matters in the whole as far as I'm concerned. And if somebody isn't in that room, why aren't they in that room? So sorry for the tininess.
So I can certainly address that one first. There is a national issue with regards to the probation funding into youth justice services. And yeah, we were given that very, very tiny allocation. I think, is it 0.1 from the top of my head of a post of a probation service officer, and certainly across most of the southwest region that has never been filled. So it is a national issue, I'm afraid, that is ongoing. The question about youth workers is I think probably a more complex one, and some history behind it. And I'm also conscious of what your definition is of a youth worker. There are, I couldn't tell you a number of workers that are employed to specifically work with young people or teenagers. I know that the predominantly youth services, more sort of traditional youth services, are delivered in a number of different ways, but not directly through council-employed workers, often through other funding streams, parish councils, funding routes, organisations like Youth Connect.
But if you don't live in an area that's parished, you have nothing. And in the city of Bath, there are very limited youth services, and the youth services sit on the south side of the city. If you live in other parts of Bath, you have very little access to them.
Chair, can I, because
Yes.
we're drifting in, if you like, into politics. What I would suggest is we put an extra £50,000 into youth services specifically focused on Bath in the budgets this year. So I think it would probably be worthwhile when in the next item on the agenda is you're going to be looking at the forward programme. I think it's a very, very valid comment that Councillor Wright has made, because it is an issue of how do we provide effective youth services where the parishes pay for their own youth services. So then you get the tension about, well, parishes have got the money, spending money, and Bath's getting it for free. So there's real tensions there, but I do think it's a very valid question, and if you do feel able, we could perhaps put that on the forward programme.
It's also something that I think will be picked up in the work that the task group will be looking at around that early help and support in terms of prevention as well. So it's, you know, it won't be lost, as and I think it's well recognised too. Okay, so my next on my list is Ruth and then David.
Thank you. So yes, thank you for the report. Just on that last point about prevention and diversionary work with young people, I have Western. Well, we have asked for some Bath neighbourhood still funding to go towards the Youth Connect Southwest work within the ward, but again that is only for a limited period, so any further kind of funding would be very, very welcome. But what I was going to ask you about was the point on strengthening participation, and so I was interested to see you at one point, children, we have so we've got children on all practitioner recruitment panels, so I'd like, if you could tell us a bit more about that, I'd be interested. And then the other question was about the volunteer panel members and mentors, and I just wondered, yeah, how many, if you got those figures, and are these people with, some of whom I guess with lived experience, and do you see that as a sort of sustainable model going forward? So a bit more about that would be useful. But yeah, very pleased to see that, you know, children are being, you know, listened to right at the start. So it's really important. So yes, thank you.
So yeah, I can say a bit about the recruitment process. We've sought to involve children in the recruitment of our teams in a number of different ways, in part through asking them for some questions that they might want to ask the participants, and also through helping them to set some of the standards that we would want to see in a worker. So if we were going to sort of recruit your ideal worker, what kinds of characteristics and you know, traits would you want to see? So we've done some of that work. And then in terms of them sitting on the interview panels, we've done that in a number of different ways. Sometimes we've had a sort of an adults panel and a children's panel separately, and the children's panel has perhaps the candidates have come in and undertaken a little group activity with the children, and then the children have had an opportunity to ask their own questions to each candidate. And then sometimes we've had it where the child has sat on the sort of the main panel as well. So it's kind of depended on, in part, the number of children that want to take part at any one time, and what might meet their needs best in terms of including them in the process, really. Some are more into sort of wanting to have their own separate group and their own separate panel, and some are like actually would quite like to be part of the sort of, you know, the main panel as well. But overall, it's been really fantastic, and I just think that, you know, we need to be doing that for all recruitment, because it really gives the panel an excellent insight into how that candidate is going to communicate with children and work with them, and how it's going to be received by the, you know, the children that are on the panel. So yeah, it's great. It's yeah, it really adds to the whole recruitment process. And then our panel volunteers. So we have two sorts of volunteers: the referral order community panel members. They have been in existence for a number of years, probably around 20 years now, at least 20 years. And those volunteers support the facilitation of our referral orders, which is the first court order that children get if they do end up in court. And their role is to meet with the child and the parent and to help work out with them a programme of work for the duration of their order, and help to think about some ideas of how they could make reparation for their offending. And so we've recruited 4 new volunteers this year in total. And I think we aim for our new volunteers to be representative of the local community. I think that can be a challenge, given how people are able to give up their time. But we have got a couple of local people and a couple of students. So we're pleased to see that there's a range of ages within our volunteer panels at the moment. And then a couple of those volunteer panel members are also going to be mentors for children too. So that's an additional service that we're hoping to offer to children who are coming to the end of their work with the Youth Justice Service. And that offer fits really well with the lived experience mentoring that the Violence Reduction Partnership have commissioned the Southside service to deliver. And those those mentors do come with some lived experience of violence themselves. And so we really do see the value in making sure that anyone who, the value in people coming to this kind of work with lived experience and what that can offer to the children that we work with.
Thank you, Carla, and thank you for those questions, Ruth. David, you're next on my list, followed by Mike.
Thank you. Thank you very much for your report. It's really, really quite detailed and inspiring. With respect to delays in diagnosis, does delay in diagnosis of ADHD, therefore delaying treatment and therapies, influence involvement with the youth justice system?
So I certainly know that the approach within services these days is if children are presenting with a certain need, that we need to be needs-led and not necessarily always wait for a diagnosis before trying to meet those needs. But certainly unmet need is a factor for children in the justice system. I just wondered if I could clarify a bit more about your question and how you would want me to answer it in relation to youth justice.
I was just wondered if ADHD per se is a bigger risk factor, if you like, for involvement with the youth justice system.
Not necessarily, but certainly a feature of ADHD can be around impulsivity with decision-making. So it is something that we do see with some of the children we work with, but not entirely.
Thank you, David. Michael, I think you might be the last person apart from me.
It's kind of an anecdotal, really, but I spent yesterday with the local Bobby on the Beat in Midsummer Norton, and we were sort of walking really around the skate park in Midsummer Norton, which attracts a lot of young people. And he was highlighting to me the need for some practical things like bins and a bench for them to sit on. And sorry?
Sorry, did you say a bench?
A bench, yes. It's the practical things I'm looking at the moment. But in terms of, I'm going to spend a day with him, kind of going around the whole of my ward and just identifying those areas where of general issues to do with crime, and but I'm interested in talking as well to Youth Connect Southwest and get their perspective on things. But from my point of view, it's the kind of lack of provision for young people to have somewhere to hang out, which is kind of where they want to go, and that's been one of the problems of antisocial behaviour, and particularly around the skate park. And I guess the learning that I might get from my time with him and with Youth Connect Southwest, if there's a way I can feed that back to your team, just to kind of give a North East Somerset perspective rather than a Bath one, and some of the issues that we're having in Midsummer Norton.
Thank you. Yeah, it's really good to hear from from the area that you're representing. And certainly we would promote the increased use of safe spaces for children and the approach that children need to feel that they belong to an area. But I'm not saying I have the answers to that or any funding to meet needs to increase those safe spaces that are really needed for children. But I certainly hear what you're saying.
Michael, can I also suggest that you feed it back to me, please? Because it's a wider issue than just the youth justice.
Okay, so Leslie, is that because I raised that thing saying that it would be the last person before I spoke?
I just wanted to raise a point of information because we're talking about the youth justice system. We're talking about the high numbers of young people who are going through it who are on the spectrum. And if you look at the figures nationally, and they're not exact, but what they're saying is around 50% of the prison population is somewhere on the neurodivergent spectrum, and it's probably nearer to 70 or 80%. So the work that's being done around keeping people out of the youth justice system is really, really important. Thank you.
A very valid point, Leslie. Oh my goodness, I shouldn't have said it was the last speaker, should I? Kevin, can you make sure it's brief?
It is, but I just wanted to follow up on Ruth's point and also possibly links in with Leslie's, just to say that on the prevention support of things, that I do understand that there are issues around parental access to the systems, but also if we're doing something nationally, it's back to schools with the actual support services that should be around them, working around them. They are identifying need. Sadly, there is not the need, not the services to support that need, either externally or internally to do that, and the capacity.
I think that's a comment that doesn't necessarily need an answer, but I think again, I would expect that to be picked up within the work we do in our task group. So my questions are relatively, well, I don't know if they're relatively straightforward or not really. I wanted just to make a couple of points about knife crime. So obviously you have your report within there. But one of the findings that we had as a panel was that the earlier that intervention could be, the better the outcome for the child. And from my reading of your report, it seems that you start at a slightly later stage, and therefore you're talking about intervention rather than prevention. I appreciate that's a subtle, nuanced difference, but I just wondered whether or not what your comments were about that much earlier intervention in terms of the prevention, if we're looking at, possibly even from some birth onwards, one would assume that would create a better set of circumstances. Therefore, you would have less children falling into youth justice and also falling into, carrying knives, etc., etc.
I would certainly support that, prevention is better than cure in itself. And it's vital that all of children's services are preventative in their nature, whether you're talking about the nurseries that we were talking about earlier and education provision and other support services for families, whether that's children's centres or what have you. All of those kinds of services, whether universal or more targeted, are around preventing poor outcomes for children across the board, of which potentially involvement in the justice system is one of them. So I would certainly recommend that early help is early, and that children are supported and families are supported when problems start to emerge, whether that's through an early help assessment being undertaken for the needs to be understood at an early stage, or what have you. But certainly our prevention service in the Youth Justice Service starts at the age of 8, which is pretty young, but not necessarily early if those problems were emerging when that child was 4 or 5. But in terms of a prevention of offending service, I think that's an appropriate age to start that. I think that other preventative and early help services would be more appropriately focused in other ways, rather than labelling a child at sort of any younger than that as to be involved in a prevention of offending programme.
Thank you. I think that's been very, very useful. I also wanted just to pick up on a point that's kind of been referred to a little, which is around the non-white population, which is it's 9.3% of our population, and of which the higher proportion are of Asian heritage, although actually got a far higher proportion of mixed heritage, but a very small proportion of black ethnicity. So I wondered, whether, because we talk about that people, and I dislike the phrase BAME, are what's the word I'm thinking of? They're not, that they are more represented within the youth justice system than the proportion that they are of the population would warrant. But I wondered whether or not you could just spell out a bit more about the difference between those two sort of core parts of what we have within Bath and North East Somerset in terms of the BME population.
So in terms of the numbers of children in the justice system, based on the different ethnicities, these numbers can fluctuate because we are talking about small numbers. And so at any one point in time, some particular groups can seem to be more overrepresented than others. Having said that, there is a reasonably consistent pattern that children of a black and white mixed ethnicity are the highest group who are overrepresented, and that children from an Asian background are massively underrepresented. Does that answer your question?
Absolutely answers my question. And as you say, it's, the numbers are very, very small anyway. Those are falling into the youth justice system. It's, I think, 0.6% of sort of a child population of 17,000, so it is a very small number. And then I just really wanted to pick up one more point around intersectionality, which is around that crossover between race and socioeconomic sort of background, because I think we will all recognise that poverty is going to be a driving factor.
I mean, certainly the whole aspect of intersectionality is something that we really take into account, whether we're talking about a whole range of different protected characteristics that the children we work with have, so whether that's around ethnicity, gender, the special educational needs that we've talked about, potentially other disabilities. Rates of poverty, that's not something that we have data on, but certainly anecdotally, it would be our estimation that the children and families that we work with do come from some of the poorest backgrounds within our neighbourhoods.
And I think there's been some research as well that says that people in wealthy areas who live in poor areas are more adversely affected by poverty than they would otherwise be. So I wonder if also that might be something you might want to consider in in the work you do as you move forward, particularly around positive role models as well. So I know that you've mentioned in this report and in previous reports about trying to ensure that you've got people that effectively look like some of the children that are coming in into the service. But I wondered also about some of that around perhaps white men from a poorer background, whether or not that's an area that you have considered exploring as positive role models.
I mean, certainly we touched on earlier the importance of having some people within perhaps a sort of mentoring or within service who have some lived experience, and that is something that we do value and recognise as being something really important, so that children can feel like yeah, they can see themselves perhaps in their workers and the people offering support to them. They don't want to feel like this is some detached person that knows nothing about me or my experiences. So, yeah, we do. I think that that's a really important.
Okay, and then my very last point is just a slight, I think there's been a slight arithmetic error on page 112. I think 137 minus 108 is not 24, it's 29. But I'm sure you can correct that. 112, and I think in the text you say that there were 24 first-time entrants, but I think, unless I've just misunderstood the sum, it should be 29. I think we're now done with this item, so thank you everybody for your very diligent work on this and very insightful questions. We're now moving on to item 7, which is the minutes from the 14th of April. Can I just ask if they are correct, if it's a correct portrayal of our meeting? I'm not sure portrayal is the right word. Record is a better word. It's getting quite late.
Move the correct record, Chair.
Thank you very much. So, and is there...
Second?
Oh, no, Paul wanted a second, so I think we can just vote on whether this is accurate. All those in favour? Lovely, thank you very much. If there's any items that have not been, that you're not aware that have been carried forward, that was not being answered, perhaps outside of this meeting, would you please, as we said before, let Mark know, and then we've got a proper list of questions that need to be addressed. Okay? Then we move on to our panel work plan. So we've got a couple of items that I think have come up through our meeting, including what? This is...
Music service.
Thank you very much, Chris. The music service. So is there any other items that you'd like to include? The youth service. So, Kevin, was that your... Yes? Joanna?
Could we make a visit to the magistrate's office?
Yes. So we could have... we will see whether or not that's possible. And, yeah, and certainly take that forward. I think that would be a very interesting trip. Ruth?
Yeah, I was just going to say at the end of the minutes from the last meeting that we've just approved, there were a couple of suggestions, but I don't think they've appeared yet on that list. I mean, it doesn't have to be with a date yet, but
yes.
Review of local services concerning neurodiversity and home education.
Yes. Okay. Well,
but so if they could go on there, that'd be good. I'm just checking. I don't think they're already on there.
Okay, so those items, and I think there's certainly some items that have been on the list for quite a long time, including child sexual exploitation. I think we should, make sure on the next agenda that's looking at children's services.
They're already on the agenda, but maybe we should move them forward a bit. For example, the community services transformation.
Yes. I think we were given a date because that was one that Suzanne and Becky agreed on, I think. But we can certainly look and see if that can come forward.
Okay, and we're obviously going to get an attainment gap project update from St John's Foundation.
Yes.
The other thing I would like to raise is that Alison Bourne, we're supposed to get a reply to our recommendations from the Knife Crime Prevention Task Group.
I think that was going via... Oops.
In the update, from company update and Carla's report.
Yes, so I think Paul May was the lead on this, but I don't know if there's more that Alison was going to add.
I think she was going to add it because I think because she wasn't approving, I believe, something like I have the numbers somewhere, but she wasn't approving something like 2, 3, and 5. or 3 and 5, and she'd approved 2 and 4. And the recommendations in this report don't have any numbers. They have bullet points.
I think Paul was the one who was agreeing with the 3 or 4 recommendations, and Carla was picking up the other recommendations within her update. But you're right. I mean, it wasn't absolutely spelled out which recommendation she was responding to. So I'm not sure why Alison is involved, but maybe we can pick that up and we'll just have a chat afterwards.
Yeah.
Okay.
Or maybe it can appear in Alison's next report.
Yes, if it's appropriate.
Yeah,
Kevin.
There was, I think it's probably public health, but the school's wellbeing survey, the results and outcomes, it was supposed to be out in January, but I've not seen anything about it.
Was this the old shoe report?
The old shoe report, yeah, which should be annual, but I thought there must be something coming out of it that's important.
Perhaps, Chris, you could enlighten it?
I can check the date when it's coming out, and we can see when it fits on the plan. I'm not aware that I've seen it yet, but...
Joanna.
Online safety. I brought it up a few times and thought there was going to be something about how we were going to deal with online safety for young people.
Did that not get passed to the safeguarding group? If it's not been discussed through the safeguarding partnership, maybe it's something that should be being discussed there? And then a report could come back here?
I can certainly check if it's been through the agenda. I mean, it's a broad topic, isn't it? But I can certainly check with Kirsty Webb, who's the business manager.
Thank you, Chris. Anything else anybody would like to see in a forthcoming meeting? Leslie? Would you like to put your microphone on?
Sorry. I think at some point it would be helpful to have a look at the initiatives around the social care services that have been brought back in-house, because in particular around bringing down those waiting list times, which are not anything that we generated. It was passed to us, but it was one of the issues that came up in the CQC report, so it'd be good to have a look at those.
And I think that would come from, as you say, the CQC report and an update on that. So maybe we could ask Alison to pick that up in the next meeting. September. Okay, all right, so September then. Right, in that case, if we have nothing else anybody wants to say, I'd like to thank everybody for your attendance, and I would now like to close the meeting. Thank you very much.